play the video.
ईश्वरा जगदीश्वरा सर्वेश्वरा नमो नमो ईश्वरा जगदीश्वरा सर्वेश्वरा नमो नमो പൂവിലും തളിരിലും തുഷാരബിന്ദുവിലും മണ്ണിലും വിണ്ണിലും വിളങ്ങും ഈശ്വരനേ ഈശ്വരാ ജഗദീശ്വരാ സർവേശ്വരാ നമോ നമോ ഈശ്വരാ ജഗദീശ്വരാ സർവേശ്വരാ നമോ നമോ.
Thank you all. Let us now move on to the inaugural session of our National PG Orientation Program. To formally welcome the gathering and set the tone for the day, I invite Dr. Subbalakshmi, coordinator of the program and professor and head of the Department of Pediatric and Preventive Dentistry, Malabar Dental College and Research Center, Kerala, to deliver the welcome address.
Thank you. Thank you. Very warm good morning to respected members of the delegation, respected President Shashikiran sir, respected Chief Guest of the day Rahul Hegde sir, respected Honorary Secretary of the Indian Society of Pediatric and Preventive Dentistry Varinder Goyal sir, members of the Executive Committee, faculty from different colleges of the country who have joined as speakers for the day, and dear postgraduates who have joined in for the first ever National Postgraduate Orientation Program of the ISPPD. First of all, as I welcome each and everyone for this session and this today, let me also take this opportunity to thank the society for putting confidence in us and giving us this opportunity to host this program. A very warm welcome to our president, who was doubly ready. The moment we said that we would like to do a program like this, sir said, yes, please go ahead, we can do it. So we are very grateful to you for the opportunity. Sir, welcome to the program. Thank you, sir. Rahul Hegde sir, again, similarly, when the moment we contacted him, I think I've only spoken to sir once. Before that, he said, yes, some initiative like this, I'll definitely be part of it for this initiative and for all other initiatives that we have taken for the postgraduates and the betterment of our society as a whole, the pediatric dentistry faculty and society as a whole. Thank you so much for giving all the support, sir, and thank you for joining us today. Welcome, sir. Very similarly, our secretary, sir, has taken, from day one, from when we have started this program, sir has rendered all his support till today morning with connectivity, everything. Welcome, sir. And thank you. And again, congratulations for being IAPD president-elect of IAPD also, Varinder Goyal, sir. Welcome to the program, sir. Warm welcome to all the EC members, all the speakers of the day. Everybody has sent us the recordings and ready with all the whatever we've asked them. All the moderators who have agreed readily to do their role. Welcome to all of them. Welcome to all the postgraduates. And I really hope that you make very good use of this program. Thank you so much.
Thank you so much, ma'am, for your warm and heartfelt words of welcome. We are truly privileged to have with us Dr. Shashikiran ND, the esteemed president of ISPPD, a visionary leader who continues to guide and strengthen the academic and clinical excellence of our fraternity. I now invite Dr. Shashikiran ND to deliver the presidential address.
Am I audible now? Subbalakshmi?
Yes, sir.
Yes, sir. Yes, sir. We can hear you, sir.
Good morning. Before I start with this presidential address, I wanted to welcome Dr. Rahul Hegde sir, an EC member in an Dental Council of India, Secretary Dr. Varinder Goyal, an heartiest congratulations to him being elected as an IAPD president of it. Dr. I.K. Pandit sir, my mentor in an pediatric society, and office bearers of an ISPPD, faculty members, and the newly inducted postgraduate students. A heartfelt congratulations to the new batch for your remarkable achievement and for choosing the postgraduate department of pediatric dentistry. From our society, we started this orientation program for first year PGs from this year onwards. This program is well designed by Dr. Subbalakshmi and team from Malabar Dental College, Kerala for 2 days, wherein the stalwarts of postgraduate teacher will be sharing the knowledge with you people. To say here some of the difference in the post-graduation study, PG experience is usually a different from the undergraduate experience. Here, there will be a shift from consuming information to the contribution to the subject field, that is pediatric dentistry over here. Before concluding, I wanted to say some of the tips for you in your pediatric post-graduation life. Be honest in your postgraduate work and show willingness to work and also to learn. You should learn from failures too. This journey will test your limits, and also to say the support system will always be there with you. Express gratitude to the faculty, staff, and families who will be supporting you. Thank you. Thanks a lot.
Thank you, sir, for your inspiring message. It is indeed an honor to have Dr. Rahul Hegde, Executive Member of the Dental Council of India, as our chief guest. Dr. Hegde has been an ardent advocate for excellence in dental education and has contributed immensely to shaping policy and promoting quality standards in dental practice and postgraduate training across the nation. We are deeply honored to have you with us today, sir. I now invite Dr. Rahul Hegde to address the gathering and for officially marking the commencement of this memorable program.
Respected President of the ISPPD, Dr. N.D. Shashikiran sir, the Secretary General, Dr. Virinder Goyal sir, the organizers, Dr. Subbalakshmi and her entire team of Malabar Dental College, the executive committee members of the ISPPD, the office bearers of the ISPPD, guest speakers, and young budding pediatric dentists. A very good morning to all of you. It's an absolute honor and privilege to join you all for this inauguration of the first National Postgraduate Orientation Program organized by ISPPD. Before I start, let me congratulate our dynamic Secretary General Dr. Varinder Goyal for becoming the President-elect of the IAPD, that's the International Association of Pediatric Dentistry. It is a proud moment for us, Dr. Varinder Goyal sir. I must compliment the ISPPD for starting this PG orientation program from this year. Last 46 years, the ISPPD has come a long way in our pursuit to give best to improve the oral health of the future generation of our country. To the young postgraduates, this is your moment to learn, network, and grow. Remember, the clinical excellence is achieved through continuous learning and dedication to your patients. Your work will not only shape the individual lives, but also contribute to a healthier society. We are truly fortunate to have a national body like ISPPD that will actively support us all through our every stage of your academic journey. I extend my heartfelt gratitude to all the organizers, including the Malabar Dental College, the ISPPD, and the speakers for their contribution. Thank you one and all. Jai Hind, Jai ISPPD.
Thank you very much, sir, for your enlightening and motivating words. Next, I would like to invite Dr. Virinder Goyal, sir, Honorable Secretary General of ISPPD, to share a few words with us.
Thank you so much, Dr. Parvati and Dr. Punya, for being the MC of the program. Honorable President, sir, Chief Guest of the day, Dr. Rahul, Dr. Subbalakshmi, the coordinator of the program, my senior colleagues, friends, presidents or past presidents of the society, and the postgraduate students. I'm really happy to get your blessings and wishes after getting elected in IPD. No doubt, when I was a pediatric dentist, to start with as a postgraduate or just completed my pediatric dentistry, I could never ever even dream of this kind of day that ever it will come into my life. And it is all because of the blessed support from my friends, from my family, for all of you. And of course, because of blessings of the God Almighty, I think I was able to be there. And thanks to Dr. Siva Kumar sir for giving me this idea of having a first program, orientation program for the first year postgraduates. I'm really thankful to Dr. Siva Kumar, and because of his suggestion, this program is into place now. And thanks to you, Dr. Subbalakshmi, for carrying out this program first time for ISPPD. And without further delay, I won't come in between this program and the postgraduates. I take leave, and I wish all the best to this program and happy learning and for all the first year postgraduates. Thank you so much. Thank you so much once again.
Thank you, sir, for your gracious words. With that inspiring inauguration, we now move on to the academic sessions of the day. Each session today is designed to provide valuable insights that will help every new postgraduate navigate the exciting journey ahead in the field of pediatric and preventive dentistry.
The first session of the day is ISPPD and What is in it for you by Dr. Sudhindra Balika. I now warmly welcome our moderators for this session, Dr. Shashikiran ND, President of the Indian Society of Periodontics and Preventive Dentistry, and Dr. Virender Goyal, Secretary General of the Indian Society of Periodontics and Preventive Dentistry, to kindly take over the proceedings.
So with your permission, we'll start, sir. We'll start with the programs itself, sir.
Yeah, I think we should start without any delay.
Thank you, sir. Thank you, Rahul, sir. Thank you all for joining us for the inauguration. We'll start with the program right now. Uh,
Shall we introduce Dr. Sudhindra Balika here?
yes, sir. Yes, sir. Thank you, sir.
Good morning, dear postgraduate students. We have first speaker with Dr. Sudhindra Balika. He is working as a professor in the Malabar Dental College and Research Center. He was previously a dean in Sharad Pawar Dental College and Hospital in Maharashtra. He graduated from the L. Shetty Memorial Institute, Bangalore in the year 1999, and periodontics post-graduation from Yanapoya Dental College. He has completed his PhD in the field of periodontics. He is a fellow of the prestigious Royal College of Physicians and Surgeons in the Glasgow, associate editor from 2012 to 2016, and editor-in-chief from till 2021 of the JISPPD. He is now a president-elect of the prestigious ISPPD. He has published more than 100 peer-reviewed scientific papers. Let us welcome Dr. Sudhindra Balika for this first presentation of first orientation day for the postgraduate students of first year MD. Thank you. Sudhindra Balika, please.
Thank you, sir.
गुड मॉर्निंग सर. गुड मॉर्निंग सर. पंडित सर कैसे?
Pavni, can you please allow me to share the video?
Ma'am, Punya can share the screen, ma'am. Ma'am, now you can share the screen, ma'am. Started the screen sharing.
I think I cannot see the screen. It is mentioning that Dr. Subalakshmi has started screen sharing, but I cannot see anything on the screen. It's a blank. What is the issue? Pavni, are you sharing the screen or someone else is sharing the screen?
Sir, ma'am, Subbalakshmi ma'am will be sharing the
Good
screen.
morning, everybody. I will.
I think there is some internet connection issue, maybe.
Just give me a moment. I will be sharing the screen. Ma'am have sent it to me.
Yeah, it's better because I think there is some internet issue at their end.
Pavni, can you please share it?
Oral health. Now, ISPPD is dedicated to advancing child oral health in India. Good morning, everybody. I welcome all the young first-year postgraduate students, the specialty of pediatric and preventive dentistry. I am Dr. Sudhindra Baliga, President-elect of the Indian Society of Pediatric and Preventive Dentistry for the year 2025, and I would like to formally introduce to what our society is. Well, this is the national body for child oral health. Now, ISPPD is dedicated to advancing child oral health in India through education, research, prevention, and clinical care, ensuring every child's right to total oral health. The society emphasizes that every child in India has the fundamental right to total oral health. The main aim of our society is compasses in three divisions, that is education, research, and prevention. We educate the masses to make sure that we promote oral health awareness in children and their families also. We are involved in active research in the society because research is an important component which drives improvements in the child oral health practices, making sure we enhance the treatment and preventive strategy. Preventive initiatives is very important among children. That is why an added component of preventive dentistry is there in our specialty. Now, when was our society formed? It was way back that in 1979, we started the Indian Society of Periodontics and Preventive Dentistry. However, now we call it Indian Society of Preventive Pediatric and Preventive Dentistry. The whole aim was to enhance child oral health, paving the way for a national body focused exclusively on pediatric dentistry. So we started our first conference at PGI Chandigarh in November 1979. And from there on, we have gone a long way ahead. And now we have more than 2,000 members across the country who have showcased the increasing commitment of professionals towards improving oral health standards in children. Now coming to the most important component, the whole objective of what exactly is your role and how do you become a member. Now, there are two types of members, that is student membership and the life membership. Now, student membership, we give access to resources and networking opportunity. The fees is around 8,000 plus GST, which as per the decision which we had taken in 2022 for registration. Lifetime membership, one-time benefit, that is including all, which we charge around 8,000 plus GST. However, now let me explain to you why this is important for you to join ISPPD and what is the relevance when you take up during your PG journey. Now, being a student aligns you early with the national body of your specialty, which is very good to build up your academic profile and professional network. You meet up at various conferences, your fellow colleagues from across the country. You get an opportunity to listen to everybody whenever you attend conferences, conventions and workshops, and it also helps you to present your research, learn from experts from India as well as abroad, and stay updated with the latest trends. So what is important is attending conventions and conferences becomes important to build your profile and ability to learn something new. From society, what do we do for the students? There is a lot of work going on in the specialty in the form of the thesis. So we give students whichever study, not just thesis, it's also including any research which is done at the level of the institution. The ISPPD has made itself for availability of grants which could support your PG research. Membership also adds to your CV and resume when you move into practice or academia, wherever, not nationally, internationally also. It helps you to build up your career through taking up small leadership roles, interactions with senior specialists, and also helps you to build mentorship and collaborative opportunities. When you convert your student membership to life membership later, you did not pay anything extra as you were a student member already. What are the membership benefits once you become a life? Enhancing opportunities for PG students, national networking, conference and workshops to attend, opportunities to become member of international association like the International Association of Pediatric Dentistry of IAPD or even Pediatric Dental Association of Asia through the ISPPD. We are also included research presentations, grants and scholarships. You get access to journals and newsletters. And at the end, when you become a life member, you are entitled for voting and taking up leadership roles. How to join ISPPD? First is eligibility check. We make sure that we have to know whether you're postgraduate students. Taking up proper document gathering, wherein we come with what exactly your assigned authority, that is the HOD as well as the dean, telling that you are a postgraduate student. There is an application for which you have to fill, make a payment fee of ₹8,000, and finally at the end, for 3 years, once you come out of the student membership, you just have to maintain that and take up. And once you apply for life membership, it gets transferred to becoming a life member. So in summary, ISPPD has been a national body since 1979. So we go way back 46 years, and we have dedicated ourselves to enhancing child oral health in India. And it also provides strong and professional benefits, which has access to national and international networking, participation in conferences and workshops, opportunities for research presentation. So joining early maximizes your potential for personal growth and professional development. Thus, by becoming a member, you align with a community committed to improving standards in pediatric and preventive dentistry, ensuring a brighter future for the child's oral health needs. So, for any information pertaining to ISPPD, you can contact Dr. Virender Goyal, who is the secretary of our esteemed society, and his office is based out of Punjab right now. We have a query, if at all required for membership, you have a number, you can contact our website. Definitely become a student member, and it will be converted without any charges over a period of time after 3 years once you complete the specialty. So welcome to the small family of the pediatric dentist, and all the best for your 3 years of your postgraduate life. Thank you so much.
Thank you very much.
Thank you, sir, for that insight. Yes, sir.
Yeah, continue. Yeah. Dr. Virender?
Thank you, sir, for that insightful presentation and to our moderators for skillfully guiding the session. I now request the moderators to kindly present the certificate to the speaker.
So we request you to say a few words and then give these certificates, sir. We kindly request the President and Secretary of our society to say a few words regarding ISPPD and what's in store for our PGs, and then hand over the certificates, sir.
Definitely, President-elect Dr. Sudhindra Paliga spoke very well about, he has introduced what is the benefit of becoming an ISPPD member. What are all the things we are doing in an ISPPD? Everything has been condensed properly and then he put it in a proper way. Then thank you very much for Sudhindra Paliga for a wonderful presentation. Then thank you, Subbalakshmi ma'am. Thank you.
Secretary, sir.
We'll request Dr. Sudhindra Paliga to accept the certificate of appreciation.
Yes, Dr. Subbalakshmi.
Sir, would you like to say a few words about the same topic before we go on to presenting these certificates?
No, absolutely. He has already mentioned everything, all the details, even my office details, he has mentioned it. So that's absolutely fine. And if at all any of the student need any kind of help or any of the live member needs any of the kind of help, we are 24/7 for all of them. We are always there for them.
Yeah. Thank you so much,
Thank
sir.
you.
Thank you so much, both the chairperson. Thank you. Thank you,
Thank you,
Subbalakshmi.
Dr. Paliga.
Lovely, good host. Good.
Thank you,
All the
sir.
best.
Thank you, sir.
Thank you, sir. And we will now present the certificates to our moderators, Dr. Shashikiran MD and Dr. Virender Goyal, sir.
Thank you, sir. Thank you so much for moderating these sessions for us, sir. Pleasure to have you as a leader. Thank you, Shashikiran, sir. Can we have Secretary Sir's certificate, please? Thank you so much, sir, for moderating the session and for all the support, sir. Thank you, sir. Kindly accept the session.
Accepted.
Thank you, sir.
By Dr. Madhu K. And I extend a warm welcome to our moderators for session, Dr. Anshula Deshpande and Dr. Deepak P.
Thank you.
Professor and Dr. Anshula Deshpande is a professor and head of Department of Pediatric and Dentistry at Joining her is Dr. Deepak P. Bhaiya, professor and head of the Pediatric and Preventive Dentistry Department at M.R. Ambedkar Dental College and Hospital, Bangalore. He also holds the position of Assistant Treasurer of ISPPD. We are truly honored to have such distinguished moderators with us today, and I now invite them to kindly take over the proceedings.
Thank you so much. And
Ma'am, we also have Madhu sir's intro on the screen, ma'am. We request you to introduce Madhu sir. And welcome to the program, ma'am.
good morning, everyone. Good morning to our chief guest, Dr. Rahul Hegde sir, our president, Dr. Shashikiran sir, and Dr. Virender Goyal sir, and many congratulations to sir for making all of us so proud. And with this, I would like to introduce to the next speaker, Dr. Madhu. He's professor in head and a PhD guide at KLE Society Institute of Dental Sciences, Bangalore. He has graduated from Sharvati Dental College and Hospital, Shimoga, and has done his post-graduation from Bapuji Dental College and Hospital, Davangere. He has many publications in international and national index journals, and he had been our vice president, currently is vice president of prestigious ISPPD. So with this, I welcome you, sir, and we are eager to listen to you, and over to you, sir.
Thank you, madam. Good morning to all of you. Many congratulations to our ISPPD team headed by your dear President, Mr. Shashikiran sir, Secretary General Goyal sir, and Dr. Subbalakshmi and team for coming with this first national postgraduate orientation program for the first year postgraduates. And at the outset, I would like to congratulate all the postgraduates who have taken the subject of pediatric dentistry. My job is to give you a brief introduction of the curriculum in these 3 years. Well, most of you know this curriculum is an overall educational plan for a course or a program, including its goals, content, objectives. Whereas syllabus is that document that details the specific topics, assignments, and assessments for a single subject within that curriculum. So our curriculum is based on the regulations by the Dental Council of India, Master of Dentistry, those regulations 2017. The period of training for the award of MDS course shall be for 3 academic years as full-time candidates by institution, including the period of examination. So most of you are aware of it. But one thing you should be aware, the time period required for passing out the MDS course shall be a maximum of 6 years from the date of admission in the sentence. So at the end of 3 years, the objective of pediatric dentistry is that a candidate should be able to create not only a goal child, but also good citizen of tomorrow, instill a positive attitude and behavior in children, understand the principles of prevention and beauty dentistry right from birth to adolescence, guide and counsel the parents in regards to various treatment modalities, prevent and intercept development. See, at the end of 3 years, you should be skilled enough to obtain a proper clinical history, do a methodological examination, thorough interpretation of all the investigations, and present a comprehensive treatment plan to the patients, and be competent to treat dental diseases which are occurring in child and patient, manage to repair and restore the lost tooth structure, to maintain harmony between both hard and soft tissues, oral cavity, a comprehensive management of special children, and to acquire skills in managing efficiently life-threatening conditions with emphasis on basic life support measures. And you should develop an attitude to adopt ethical principle in all aspects of periodontic practice. Professional honesty and integrity are fostered. Willingness to share the knowledge and clinical experience with professional colleagues is most important. Treatment care is to be delivered irrespective of the social status, caste, creed, religion of the patients, and willingness to adapt after the critical assessment of new method and techniques of periodontic management, developed from time to time based on scientific research, and respect the child's rights and privileges, including the child patient right to information and right to seek a second opinion, develop an attitude to seek opinions from allied medical and dental specialties as and when required. Your first year of post-graduation, first 6 months will be a preclinical work followed by an academic and clinical work for the period of 7 to 36 months. So after you fulfill all the requirements of preclinical and academic and clinical work, which will be discussed later. So this is the minimum eligibility for any candidate to appear for the final MDS examinations. During the post-graduation period, each student should take part actively in teaching and planning activities designed by the institution or the university. There shall be some didactic lectures in the specialty and in the allied fields. The department shall encourage guest lectures in the required areas and integrated lectures by multidisciplinary teams on selected topics to strengthen the training programs. Students shall present 5 journal clubs, 5 seminars, and 4 case presentations per year. following which each trainee shall work in the clinics on a regular basis to acquire adequate professional skills and competency in managing various cases. And it is recommended to hold symposium on topics covering multiple disciplines. And to encourage integration among various specialties, there shall be interdepartmental meetings chaired by the dean with all the heads of the postgraduate departments at least once a month. All postgraduate students shall be encouraged to take part in undergraduate training programs either in the form of lectures or discussions. The students are supposed to take one lecture a year. And each department shall organize dental education programs on a regular basis involving other institutions. The trainees shall also be encouraged to attend such programs conducted outside their institute. So there shall be 2 presentations in clinical pathological conferences per PhD student in a period of 3 years. And these clinical pathological conferences shall be held once a month in one of the faculties of oral medicine and radiology, oral pathology, and allied clinical departments. And to bring in more integration among the specialties and allied fields, each department shall work out a program to rotate the trainees in related disciplines. The student shall be encouraged to attend conferences, workshops, advanced courses, and also present at least 2 scientific papers and 2 posters at state or national level, specialty and allied conferences or conventions during the training period. And 1 library dissertation should be submitted within 18 months from the date of commencement of the course. And most important part, the dissertation, wherein you will be submitting the synopsis in the first 6 months after joining. Synopsis, the gist of dissertation of the research work, whatever you are doing. And the final dissertation should be submitted within 6 months, before 6 months of your examination. And finally, coming to the publication, it's not mandatory to have a publication. So in the DCR regulation, they mentioned it as optional, but it is good that you have a publication, 1 publication before the issue of post-graduation. The course contents of your pediatric dentistry includes your applied basic sciences, which includes your applied anatomy, head and neck, physiology, pathology, microbiology, nutrition and dietetics, genetics, and growth and development, for which you will be giving a basic examination at the end of this year. And these are the course contents for your clinical pediatric dentistry. So monitoring learning process is the most important aspect in this graduate program. It is essential to monitor the learning progress of each candidate through continuous appraisal and regular assessment. It not only helps teachers to evaluate students, but also students to evaluate themselves. The monitoring is to be done by the staff of the department based on participation of students in various teaching and learning activities. It may be structured and assessment be done using checklists to assess various aspects. Checklists are given for all the exercises in the department. And to be eligible to take up your final MDS exams, there are certain requirements. Every student shall secure 80% attendance each academic year. Every student shall participate in seminars, journal clubs, symposia, conferences, case presentations, clinics, and didactic lectures during each year. Every student shall maintain a work-oriented logbook recording participation in training programs conducted by the department. And all this work-oriented logbook should be verified by the concerned staff, signed by the concerned staff, and certified by the head of the department. So the university examination, final university examinations will consist of theory, clinical examination, bios, and pedagogy. Part 1 examinations will be appearing at the end of first year. The student shall have to secure a minimum of 50% of the basic sciences and shall have to pass the Part 1 examination at least 6 months prior to the final examination. And Part consists of three papers at the end of your postgraduate course. In clinical examination, we have 3 exercises followed by viva versus pedagogy. And these clinical examinations are conducted to assess your competence of managing the patient and communication and aspects, and to make sure that you can handle a patient independently at the end of the course. That completes curriculum overview. And I sincerely thank the ISPPD Head Office and Dr. Lakshmi and team for giving me an opportunity to do this presentation. And I welcome all the new postgraduate students in this wonderful world of pediatric dentistry. Welcome aboard. Thank you and wishing you all the best.
Thank you so much, Dr. Madhu. It was very nicely mentioned in a very nutshell. Yeah. Am I audible? Hello.
Yes, ma'am, you're audible, ma'am.
Yeah. So, sir has very nicely highlighted the salient features of curriculum provided by Dental Council of India. So, all of you should remember that in professional education, the curriculum does not just defines what we teach, but who we want our students to become tomorrow. So the curriculum will act as a roadmap which will turn learning into growth and education into excellence. And we all in ISPPD want all the budding pediatric dentistry to excel and become a good pediatric dentist who are knowledgeable, skillful, and they work with all the ethics. So if anyone has any questions, you can just put on your chat. So DCI follows 2017 MDS curriculum, which is available on website. You all can have a roadmap from that. Most of the universities, they have, that is the basic this thing, so that all the postgraduates at national level have a same level when they pass out and get the degree. So over to Deepak sir. Hello.
Deepak, sir. Sir has joined us.
Dr. Anshula, I just interrupt between because there is some cyclonic activity, I think, in southern part of India and the eastern part of India.
Oh.
So that's why some internet lag may be there because Pavani just informed me that because of some network issues, there some delays, but that's
Some
okay.
people.
Nothing to worry. We are on it.
No problem.
Yeah.
So
Sorry
I
for that
really,
inconvenience.
no, thank you, sir, for letting us know. So thank you
Thank
so
you.
much, Madhu, sir, for orienting our new postgraduate students. And over to the organizers for the certificate to be
Thank you, ma'am.
presented to Madhu, sir.
Thank you, ma'am. I think Deepak sir is not able to, is having connectivity issues. Sir had joined and sir had messaged. So, ma'am, we request the moderators to kindly present the certificate to Madhu sir.
So it's our honor, and it's my honor to, and on behalf of Dr. Deepak sir as well, to
Thank you.
present the
We will now
certificate of
present the
appreciation.
certificates to
Thank you, Dr. Anchula. Thank you, Dr. Sublakshmi. Thanks, everyone.
Thank you.
Thank you. We will now present the certificates to our moderators.
Thank you, Anshula ma'am, for joining us today and moderating the session. Thank you. It's been a pleasure. Can we have Deepak sir's certificate?
Do you have any other laptop around you which is
Thank you, madam. Thank you very much.
Yes, sir. Why, sir? Is there some disturbance, sir?
Yeah. Because of that, echo is there.
Echo,
Because
yeah, that
the
is
sound
resulting
is
in echo.
there. Because you are connected with two laptops altogether.
Oh,
so
okay,
one
sir,
laptop only should be used, and if you are using the other one, it has to be away
Yes,
so that
sir,
your voice doesn't echo.
Yes, sir, I'll do that, sir.
Yeah. Thank you. Now it's better. Maybe you have muted the other laptop. So it's better now.
Thank you, sir. Thank you very much. Thank you, madam.
Great. All right. Sorry, sir. Thank you. Thank you so much for it. Thank you so much for telling us. Is it better now when we are muted?
Yes.
Yes, sir.
Yeah. One laptop has to be muted and only one laptop should be used for
Yes,
like
sir.
speaking.
Yes, sir.
Yeah.
Thank you, sir. Thank you, sir. Do we need a small break or shall we go on with our next presentation, sir?
No, I think we can.
We are running a little ahead of
just
time.
12, 10, 25 only. So we can, it's not a, very long period.
Right. So
We can do that.
yes, sir.
And we are also live on Facebook. People can see us on Facebook also. Not Facebook, sorry, YouTube. And that this program is available live on YouTube in ISPPD channel.
The next session focuses on the first few months, preclinical period. Our moderators for this session are two dynamic academicians, Dr. Brinda Godi, reader in the Department of Pediatric and Preventive Dentistry at JSS Dental College and Hospital, Mysuru, and serves as an executive committee member. Joining her is Dr. Deepa Ji, Professor of the Department of Pediatric and Preventive Dentistry, Research at Chennai, who also serves as an assistant editor of ISPPD. I now invite them to take over the session along with our speaker, Dr. Seema Deshmukh.
A very good morning, respected Rahul sir, President sir, and Secretary sir. Hello, can you hear me?
Yes, ma'am, we can hear you, ma'am.
Okay.
Ma'am, I think Deepa ma'am is having some connectivity issues. So she's been trying to join us. So can we go ahead, ma'am? Can we?
Yes.
Can you please introduce
Yes.
Seema ma'am?
Yes.
Thank you.
So it's a pleasure to introduce my dear friend, Dr. Seema Deshmukh. Presently, she is a professor in the Department of Periodontics and Preventive Dentistry. She did her UG and post-graduation from AJUHS. And she has also completed her doctoral in Faculty of Dentistry from JSS Dental College and Hospital. Her area of interest is craniofacial growth and development in children. And Dr. Seema is an active researcher, and she has many publications in various national and international journals to her credit. And she is also a member secretary of Dental Education Unit. And she is also a recipient of VGSC grant for her research in the field of craniofacial growth and development. I welcome Dr. Seema for the first National PG Orientation Program to sensitize our PG students about the importance of preclinical period for first few months. Welcome, Dr. Seema.
Thank you, ma'am.
Good morning, all. At the outset, I would like to thank ISPPD for giving me this opportunity to interact with the first year postgraduate students in this first ever PG orientation program that is being organized by Indian Society of Periodontics and Preventive Dentistry. This presentation is going to focus on the importance of the first few months of the preclinical period. I'm not here to discuss with you all the curriculum or the exercises which are lined up in the first 6 months of your preclinical period, because your guides, your mentors, your teachers are all there by your side to take you through that process. I am here to brief you about the importance of this 6 months and how effectively you can utilize this 6 months to get the maximum benefit out of it. So let us begin this presentation by congratulating our dear students for having crossed innumerable hurdles and procured the PG seat in one of the very special departments or disciplines of dentistry, that is the pediatric and preventive dentistry. So congratulations, dear students. Now you have begun your journey, and in this journey you will find a lot of opportunities. At the same time, there will be challenges too. But if you are focused, I'm sure the success is going to be yours. So with this note, let us continue and look into the transition which is happening from undergraduate into the postgraduate period. So in the undergraduation, you are performing simple procedures, that too under the direct supervision of your guides or your mentors. But in the postgraduate period, you're expected to perform more complicated procedures, maybe independently. So there has to be a smooth transition. The transition is not only going to stop at a PG level. If things fall in place, then there is going to be an extremely smooth transition and converting you from an undergraduate to a postgraduate to a confident clinician. So that is what is our aim, that you all are one day going to become one of the confident pedodontists of our nation. So there is some change which is happening now around all of you. So in the undergraduate days, it is basically learning for exams. So we are all, as undergraduates, focusing towards exam-oriented preparation. However, in the post-graduation, the learning changes. It changes from learning for exams to learning for life and patient care. We try to acquire new skills. We try to enhance our existing skills so that we can give the best quality care to our patients. So that is the component of change which is occurring. So now how this 6 months are going to contribute for you towards bringing about this change. So this 6 months are going to have the 4 major pillars, which are based on which you are going to lay down your foundation for the entire PG program. These 4 important pillars are knowledge acquisition, skill development, time management, and shadowing. I'm going to go through each and every component of this in detail so that you can imbibe it during your preclinical period and come out as a confident clinician. And the transition for you is going to be extremely smooth. So let's begin with understanding how knowledge acquisition is going to happen during this 6 months. So now there are various modes of knowledge acquisition which is going to happen. Like, for example, there is going to be an immense amount of active learning. As an undergraduate, you might have been restricted to 1 or at the most 2 textbooks. But at a postgraduate level, you will have innumerable textbooks. You have dedicated textbooks, for example, the ones for removable orthodontic appliances or for pediatric operative dentistry, or there are a whole lot of manuals like, for example, Anglo and Rock or Matthewson. These are only a few examples that I'm giving you, but there will be innumerable such textbooks which you will have to go through to absorb the maximum amount of knowledge. So there is a lot of scope for active learning which begins in this first 6 months. Also, there is going to be a lot of observation which is going to happen. There is going to be reading beyond textbooks. That is, you may go through various journals, research articles. There is going to be a lot of peer learning happening and also a lot of micro learning. That means when a larger concept is broken down into smaller chunk and you go in depth into each of these smaller components and understand it thoroughly, then we call it as micro learning. So this entire components of knowledge acquisition is going to happen. So wide variety of ways by which knowledge acquisition is going to happen. So you have to be open to acquire the maximum amount of knowledge in this first 6 months of your preclinical period. The next important component is your skill development. Let us understand how the skill development is going to happen. At an undergraduate level, you were performing some basic cavity preparations on typhodont teeth or maybe extracted teeth. Then you started doing simple restorations or basic procedures under the direct supervision of your guide or your mentor. But in the post-graduation, expectation is that you perform procedures independently with precision and adaptability. You are expected to handle uncooperative patients. You are expected to handle medically compromised patients. You are expected to perform multi-step procedures like pulpectomies, crowns, space managements, all comprehensively. So these are all the skills which you are supposed to develop, and this skill development occurs during this first 6 months. So there is an immense amount of skill development is going to happen along with your knowledge acquisition, which have to go hand in hand. Another very important skill which you all need to focus is the communication skill. This is one of the very important skill and considered to be the core competency that a postgraduate student is supposed to adapt. So the entire aim of this PG program, especially during the first 6 months, lies in transforming you into a clinician who is confident in the technical work. Not only that, has got effective communication, can keep calm under pressure, and is committed to continuous improvement. So the entire aim of skill development lies under all these components. So you can imagine there is a large amount of skill development which is going to happen during this period, particularly during the 6 months. There are additional skills also which you can acquire, like learning of certain additional tools like reference management tools, for example, Zotero or EndNote, or some data management tools like Excel. These tools are going to be extremely useful for you during your PG program. Hence, I recommend you to learn these skills during this first 6 months so that the rest of the PG programs becomes easier for you. Now we are in an era where we have a lot of AI tools. It is not the aim to learn using these AI tools. The aim is to use these tools chunked to your learning so that your learning process is faster. So we have to remember that these tools are not going to replace or eliminate the component of learning.
Pavni, the video is getting disturbed, Pavni.
So learning process remains the same. These may just add on as a tools for you so that you fasten your process of learning. So you have to know how to use these AI tools effectively. Another suggestion from my end is you learn skills to prepare some educational videos as and when you are doing your preclinical exercises. Say, for example, you are learning to place a stainless steel crown. So kindly record it when you are getting the demonstration so that you can go back to those videos and analyze each and every smaller detail and refine your skills and your knowledge. So this kind of educational videos may be very essential for you. One of the example, what I am showing here, the last image is the virtual reality based tool, which was developed by the first year postgraduate students of my department. This tool was developed to educate the mothers of cleft lip and palate affected infants regarding the importance of the pre-surgical nasoalveolar molding. With this virtual reality based video, they were able to visualize how this NAM actually works. So this video was developed by our first year postgraduate students. So this is how we can acquire additional skills and become more competent as we come out after this PG program. Now let us have a look at the third important pillar, that is the time management. Now let's see how we can do this. So this can be done effectively by the triple R rule, that is the routine, reflect and refinement. To begin with, you put a schedule for yourself, that is the routine. This may include your distribution of your preclinical exercises, your reading of your articles or reading of your textbooks, and various other skills which I just mentioned you want to acquire. So put a routine or a schedule for all these activities. Go back and start implementing this routine. Then reflect upon your routine. Identify the areas which worked well for you. Identify the areas which require refinement. So based on your reflection, you refine your routine and again create a new routine and start following it. So you can understand in that way that you have effectively utilized the time and learned the maximum that you can. There is a method by which we can set up our routine that was given by a matrix, that is the prioritization matrix given by Eisenhower. This is a very interesting matrix and you can utilize this matrix in creating your routine. So this matrix has got 4 components. The first component is the one activities or the tasks which are urgent and are important. So these can be your preclinical work, your reading the assignments or writing the assignments, maintenance of logbook, which is very important because you will be submitting this at the end of your PG program. So these are the activities which are urgent and also very, very important. So prioritize them in your routine. Then there are certain kind of activities which are important, but they are not urgent. Like for example, reading articles or preparation for your seminars. So that can happen when you have your sufficient timeline. So they are important, but of course they are not urgent at that particular moment. So they fall second in your priority list in your routine preparation. The third component is those ones which are urgent, but they are not important for you as a student. For example, writing a reporting letter to the head of the institute or performing certain procedures which are required for your admission process. So these might be the ones which are urgent, but may not be important for you. So they have to be given attention or priority to. Then the last ones are the ones which are neither important nor urgent. All of you may not agree with me, but most of your activities which fall in this are screen time and the social media communication. So in your priority list, put these activities which are neither important nor urgent into the last end of your priority. So this is how, by utilizing the Eisenhower matrix, you can prepare your routine and then reflect upon it and refine if required and go ahead. So this will help you to acquire maximum from the time which is available for you. Now let's move on to the fourth very important pillar, that is called as shadowing. Now let us see what exactly shadowing is. If I have to define shadowing, it is defined as a structured observational learning process in which a postgraduate student closely observes an experienced clinician or a faculty member performing clinical and interpersonal tasks with the aim, the rest half of the definition is very important. The aim of observation is understanding not only how the procedures are being done, but to understand why the procedures are done in a particular way. So to tell you in a simple words, shadowing is nothing but observation. So let us see how do we perform this observation. This also has got a 4D model. The first component or the first dimension of shadowing is the clinical dimension. That is, in this dimension, the postgraduate student is advised to watch the faculty who is performing the procedures or the clinical duties, watch the movement of their hands, the way of the placement of the instruments, the placement of the materials, the sterilization protocol, the disinfection protocol. Observe these things. The goal is not to imitate the movements. The goal is to understand why these particular things are done in this way. So first dimension of shadowing is observe your seniors or your faculty members doing clinical procedures. The second dimension of shadowing is the communication dimension. So see how communication is being happening between the clinician as well as the parent. So how the clinician is explaining the procedures to the parent, is explaining the radiographic interpretations to the parent, how the clinician is addressing to the needs and the concerns of the parent and the anxiety of the parent, how the clinician is putting in the preventive protocol to the parent. So this communication dimension is also very, very essential. So understand how this communication is happening. So observe this communication. The third dimension is the behavior dimension. So this is the interaction between the clinician and the child. So look how voice modulation is happening, how the dentist or the periodontist is utilizing the humor, where the dentist is utilizing the praise, the timing of praise, the timing of distraction. This is highly important. And this is one aspect which you will learn. The more the observation you do, the more the shadowing you do, the better you will learn these skills. So the fourth dimension is the behavior dimension. And the fourth dimension is the professional dimension. So this is the most important dimension. Looking at your faculty members, at your seniors, you learn what is called as professionalism. How you prioritize your patients, how are you responsible, how much accountable are you for your actions, your punctuality, your discipline, your preparedness for the case. This is all covered under the major terminology professionalism. So it is very important that you have this professionalism to the utmost top priority. So shadowing has to be done under these four dimensions. So we basically group the observers into two categories: passive shadowing and active shadowing. So passive shadowing is the one where watching is happening without any purpose, whereas in active shadowing, the observer is going to set a goal. For example, I am going to observe how the faculty member is handling a very young patient for performing a particular clinical procedure. So the observation is largely going to focus on behavior management. So observe only those particular things which you have had an aim of observing. So that is the active shadowing. So you have a purpose of observation. Another component of passive shadowing is the person who is observing will observe what is noticeable or what is visible. Whereas an active observer is going to reflect on what is invisible. That is the thought process that is going through the child's mind, the empathy component. So certain things which are not visible are the ones which are observed by an active observer. In a passive observer, they do not record any responses. Whereas an active observer is going to maintain a logbook, is going to maintain a reflection log, where the postgraduate student is going to write down what all was my aim of observation, what all have I observed, and going to go through this reflection log and imbibe the maximum out of this. So this is how active and passive shadowing is going to happen. So you can utilize these few tips in observation during your preclinical period. So now we are in an era of evidence-based practice. So you are not going to believe if I just suggest you certain things. So here is a scholarly evidence where studies have been conducted to see the effective utilization of the 6 months of preclinical period. And studies have shown that certain components like theoretical knowledge, laboratory skills, clinical reasoning, communication, research ability, all these components had improved when they were compared from 3rd month to the 6th month of the PG program. It was also found that there is a strong performance in the first 6 months correlates with a superior clinical outcome throughout the PG program. And studies have also shown that comprehensive preclinical preparation significantly reduces the clinical transition stress and improves the patient care quality. So that was what our aim was. The learning in the PG program was dedicated a time towards the providing improved patient care. So the more focused we are during the 6 months, the more effective patient outcome you are going to give. Also, the studies have shown that certain core competencies like 75% of research skills, 80% of clinical assessments, 90% of technical proficiency and 85% of patient communication is all achieved during this first 6 months of preclinical period. So now you can understand how important is this 6 months and how effectively you can utilize this 6 months. So if I have to give you a roadmap for skill attainment in the first 6 months of PG, I can divide it into 3 phases. The first 2 months is largely oriented towards observation. So you shadow your seniors and the faculty members, observe the clinical workflow, understand the sterilization protocol of your department, understand the disinfection protocol of your department, observe all these things, learn certain additional tools like Mendeley or any other simulation apps if possible, maintain a reflection journal so that you can go back, reflect upon it and learn what all you have observed. That is the first 2 months. Then the next 3rd and the 4th month, you try to develop certain proficiency. That is, perform the preclinical work under guidance. Take feedback from your faculty in charge so that you understand your drawbacks and you work upon it to refine them. You assist in clinical procedures. You also assist in some behavior management so that you can refine your skills. You participate in journal clubs. Use digital data recording tools also. Start recording educational videos so that you can return back to these videos and understand the smallest details of it so that you are mastered the particular skill. Then in the next 2 months, that is the 5th and the 6th month, you do with reflection. That is, begin independent patient management, apply the behavior management skills that you have tried or learned or observed during the first 3 or 4 months. You present seminars, discuss cases, try to maintain e-portfolios. Now, e-portfolios are not a very common practice in dentistry, but it is a very important or a very essential tool for you. I have just put up an example of an e-portfolio, how you can prepare it. So you basically plan what you want to observe. You collect evidences for that. That is, you may record a video or you may take some pictures. Then you try to create a template based on what you wanted to learn and how you have learned it, or what all are the components you want have learned from it. You reflect upon it, you share with your peers, you share with your faculty members, you get their feedback, and then that is how you confirm your findings that what you have learned is actually correct, and you can understand what else is there remaining that you can learn from this aspect. So this is just an example of a e-portfolio. So these are certain ways by which you can learn the maximum during this first 6 months of your preclinical period. So as I conclude my presentation, I would like to give a few key take-home messages for you. So the take-home message is that there are 4 essential steps which you keep to bear in your mind to gain the maximum out of this first 6 months. The first thing, and a very important thing, be a very good observer. Observe as much as you can and learn the maximum during the 6 months. Indulge yourself in a guided practice. Take feedback from your seniors, take feedback from your faculty, involve them in your learning process so that you can imbibe the maximum. Do digital integration. It is very essential now that you do digital integration in your learning process so that the concepts learned are going to remain in your mind and you can always go back to them and revise it and reflect upon it. This all if fallen in place are going to give you the essential component which is required for you to become a confident clinician, that is the professional maturity. So this is my final take-home message for all of you, and I wish all the best for the postgraduate students in their endeavor. I would like to thank ISPPD for giving me this opportunity, and I would also like to thank my institution, JSS Academy of Higher Education and Research, for providing me with all the support. Thank you.
That's all regulation.
Good
Deepa
morning,
ma'am
all.
and Brinda ma'am. Yes.
Yeah.
Good morning,
Thank you.
ma'am.
Yeah, good morning, Subhlakshmi. Dr. Seema, it was a wonderful presentation. Actually, I would like to mention here her keen interest is teaching and learning methods, and presently she is pursuing her fellowship with FAMER, and it was very much reflecting in her presentation. Dr. Seema has highlighted on importance of preclinical period. And basically this preclinical phase, it bridges the transition from UG learning to advanced specialized clinical practice. I think she has gone through completely how important it is to have this time utilization by our PG students for next 6 months. And I also would put a message to our postgraduate student, hands-on work on typhodont or simulation-based training. It helps in mastering the instrumentation, ergonomics, infection control, and case documentation. So please try to imbibe all these things during your 6 months period. And I think Dr. Seema is available for your whatever doubts you have. So over to you, Dr. Seema, if any questions is there.
Deepa ma'am. As of now, we are not seeing any questions in the chat box. If there are any questions or any information that the participants may require, they are welcome to share them on the chat box.
Yes.
I think they can anytime get back to us if they have any doubts. We are all there here to guide them through.
Thank you, ma'am. Thank you for a wonderful presentation, ma'am.
Thank you, organizers, for giving this opportunity to me. Thank you, all the members of ISPPD.
Thank you
Thank
so
you,
much,
ma'am.
Dr. Seema. It
Thank
was a
you.
wonderful listening to you. Thank you so
Yes,
much.
sir. Thank you, sir.
Thank you, ma'am, for your valuable insights and appreciation to our moderators for facilitating the discussion. I now request the moderators to present the certificate to the speaker.
Yes.
Thank you. And we will now present the certificates to our moderators, Dr. Brinda Suhas and Dr. Deepa Gurunath.
Thank you.
Thank you. Thank you so much.
Ma'am. Thank you for moderating the sessions for us, ma'am. Thank you, ma'am. Thank you, ma'am.
Our next topic, seminars, will be delivered by Dr. Neeraj Gugnani. Our moderators for the session are Dr. Chandan JD, Professor, Pediatric and Preventive Dentistry at VS Dental College and Hospital, Bangalore. He is also an executive committee member of ISPPD. And Dr. J.M. Farzan, Professor and Head of the Department of Pediatric and Preventive Dentistry at Meenakshi Ammal College and Hospital, Chennai, who also serves as an executive committee member of ISPPD. I warmly welcome them to conduct this session. Thank you, sir.
Good morning.
Morning, sir.
Good morning.
Punya, can we have the speaker's intro, please?
Good morning, all. Here, welcome to the first National Postgraduate Orientation Program. Seminars are a very integral part of the starting step of gathering knowledge in the whole course of 3 years course. I hereby welcome Dr. Neeraj Gugnani, sir, who will be heading this topic. Dr. Neeraj Gugnani, sir, is working as a professor and head of Pediatric and Preventive Dentistry in DAV Dental College, Yamunanagar. He completed his MDS from KGMC, Lucknow. He has done his MSc in Clinical Trials from London School of Hygiene and Tropical Medicine and a PGCILT Master Degree in Higher Education from University of London. Recently, he has also completed an MSc in Artificial Intelligence in Healthcare from University of Alcalá, Spain. He is a devoted researcher with a keen interest in academics and has won many awards, accolades in his career. He was awarded a Commonwealth Scholarship in 2008 and joined the Dental Health Unit, University of Manchester, United Kingdom, for the research in the field of dental caries. He was also awarded the ORCEA Travel Fellowship Award for the year 2011 by the European Caries Research Organization. He has delivered various scientific presentations on many international, national platforms, and he enjoys conducting courses, workshops on various topics, which includes cardiology, artificial intelligence, research, biostatics, clinical trials, systemic reviews, special child care, early age orthodontics, and dental trauma. Who else can better guide you people more than Neeraj Gugnani sir with so much of academic orientation onto it? Welcome you, Dr. Neeraj sir. All on to you.
Thank you. Thank you, Dr. Chandan. Thank you.
Welcome, sir.
Thank you, Dr. Farzan.
Pavni, can we play the video?
Good morning, everyone. First of all, I convey my sincere thanks and gratitude to ISPPD head office, to the organizing team of this beautiful orientation workshop for MDS students, especially Dr. Subbalakshmi, along with the team at Malabar Dental College for inviting me to present this talk on preparing and presenting a seminar as a PG student. I also convey my greetings from my own department of Pedodontics at DAV Dental College, Yamunanagar, where I work as a professor. So today I am going to present a beautiful talk on how to prepare and present a seminar, which is a key component for all the postgrad students. Now, presenting a seminar as a PG student, you might think why it is necessary for us. And the first answer for this question is that it is required as per DCI norms. So each one of you has to present a fixed number of seminars and journal clubs during your post-graduation. So it also helps you to deepen your understanding about the topic. It helps you to develop deep insights into the topic because you research, you organize, and then you summarize to present. So in addition to that, you develop skills to appraise things critically. It's very important that you need, as a postgrad students, you develop skills to appraise things critically. Then it improves your presentation skills. Of course, they are required in day-to-day life, in real life. When you present, when you talk to your patients, when you are in academics as a faculty, it also helps you to learn soft skills. Now, out of all these points, I first of all want to focus you on one point as a student and all the young faculty who is present here, is that developing or appraising things critically. It is very important as a postgrad student and as a young faculty that we develop our skills to appraise things in a critical manner. Now, all the teaching and learning, whatever we do all our life, teaching and learning both is actually dependent on this specific taxonomical hierarchy order, which is called as Bloom's taxonomy. If you have gone through this, you have to see this diagram or this pyramid from bottom to top. So from bottom to top, first of all, whenever you try to understand a new thing, whenever you are exposed to a new thing, you just try to remember the thing, then you understand the thing, then you apply the thing. And these are the verbs on the right side which explain how you remember. You can define, you can duplicate, you can memorize, you can repeat. For apply, you can execute, solve. And once you are through these three steps, then you analyze and evaluate the things. Now, these are the two stages where we say that you are now able to appraise a thing, because you can argue about a thing, because you can argue about an opinion, you can compare, you can contrast, you can distinguish. And then you go to a level which is called as create. Now, as if you are teaching, if you are learning as a postgrad, if you are presenting a seminar as a student, and you are focusing only on remembering, understanding or applying, then believe me, your seminar is only at the UG level, your teaching or your learning is only at the UG level. Only and only when you are able to include the concepts where you evaluate or analyze the things, then the teaching becomes the, or the learning becomes the postgrad level. So as a faculty, we, from all the students, we aspire that you take your levels, seminar levels to a little higher level where you analyze the things in depth and then you evaluate the things critically. And the last tip create is for PhD students where you apply all these bottom concepts to make something new. So you create things. So as a postgrad, this level you should be able to achieve. And as a faculty or as a PhD student, as a postdoc, we need to create something. So design, assemble, construct, conjecture, develop, formulate, and authorship. So these are the things which is the tip of the Bloom's taxonomy. But as a postgrad student, during presenting a seminar, I really would aspire if all of you are able to reach this stage where you analyze and are able to evaluate things critically. So two types of seminar or journal clubs are given to you: journals, seminars, or journal clubs. I know Dr. Mathur will be taking the detailed talk on journal club, but just to give you an overview, just to give you a brief idea, the difference between a seminar and a journal club. First of is that seminar will be provided to you as a topic, but journal club will be provided to you as an article, published article, which you need to critically appraise in detail. So this is a tabulated form which differentiate between seminar and a journal club. When you present a seminar, you tend to teach comprehensively explaining the topic. So you synthesize the knowledge, you research it, you combine everything about that topic. But in a journal club, you critically evaluate and discuss only one or two top research papers. So that's the difference basically. When it comes to focus, in seminar, you go to breadth of the topic, but in journal club, you go depth of a topic. So depth of the evidence appraisal. So that is the basic difference. Preparation for a seminar, you go for textbooks, reviews, guidelines, etc. For a journal club, you just go to that particular paper and use the appraisal checklists to appraise that article. Structure for a seminar, it starts with introduction, maybe literature, discussion, summary. I will go into detail. For a journal club, I think Dr. Vijay will be covering it better. Presentation style, teaching oriented with visual and examples. But in a journal club, it has to be analytical with data tables, with bias assessment, with critical appraisal of the journal club. So outcome is comprehensive knowledge and understanding is the prime outcome of a seminar. But for a journal club, ability to critically interpret research and apply into practice is the main outcome. So for example, as you can see, the topic given for a seminar can be management of ECC, preventive and restorative strategies. But for a similar topic in a journal club, you might be provided with the specific article which you will be presenting as a journal club. For example, effectiveness of SDF in arresting ECC. So only one topic, only one aim, but you have to critically appraise this detailed article. So a seminar tells us what is known. A journal club questions whether we know it right or not. So you summarize the knowledge in seminar, but you go deep dive into the journal club. So I'm not saying seminar is not deep diving. Seminar is comprehensively arranging things, comprehensively organizing all the knowledge which is available and then summarizing it into a form of a seminar. So steps in planning the presenting in seminar. Unfortunately, today it is very easy to go to a Google or any other portal and copy and paste the seminar, but that is the totally wrong idea of presenting a seminar. And I really want each one of you to prepare and present the seminar comprehensively prepared by you and not copy and paste, because this is a very wrong approach. You will not be able to learn things. You will not be able to learn the concepts of critical appraisal. You will not be able to comprehensively organizing the things in your mind. That how will you present the concepts when you are in your exam, and how will you see things? How will you be able to treat the patients in real life when you don't have the academic background knowledge of that? So in spite of copy and paste, I would say you can crop. So, but by crop, I'm not saying cropping the image, but I will give you an acronym of how to plan and present a seminar. So the first thing is that collect the material. So whenever you are provided with a seminar topic, start collecting the material. Second is read. So read it in detail. Third is organize things. And then fourth is prepare the slides and then present your seminar. So isn't it crop? So rather than copy and paste, go for crop. The most important thing here is that you cannot skip any of these steps, and you cannot go to you cannot follow these steps in a non-sequential manner. Only and only this sequence will work. So you collect the material, you read the material, you organize the things, prepare the slides, and then present. You cannot start preparing the slides while you are collecting the material, because then the total flow will not be exactly as you actually want, or it will not be the best flow. You cannot start copying from here and there and then start preparing the slides. No. So crop is the true state of preparing, planning, and presenting the seminar. So collect the material, read, organize, prepare slides, and then present. So how to structure the seminar? As I told you, this is the acronym. So let's start with collect material. How? What is the meaning of collect? So standardized textbooks can be the first source, like McDonald's, like Pinkham, like other Indian textbooks. Topic specific textbooks or compendium. As you can see, I have just posted 3 over here, like a book on early age orthodontics. If you are given a seminar on orthodontics, traumatic dental injuries, there are many books by Springer. Then there are some compendium on caries, on fluorides, on other topics. So you can choose, because these are these compendiums and small textbooks are summarization of the complete knowledge when they were published. So they are quite contextual in nature. So you can also go, you have to also search articles from PubMed, from Google Scholar, from Scopus. So important journals of pediatric dentistry and even allied journals. So ISPPD is one of the examples. Literature from the company website can also be advantageous if you are presenting a seminar specifically on some restorative material or something which is the company-based material. So you can just directly go to the website and find the product literature, and then other web sources, for example, YouTube, and even ChatGPT can help. But don't rely totally on the ChatGPT. Don't copy and paste. Crop is the total acronym that you have to do. For that, C, that means collecting the material in a systematic manner, should be the first step. So I'm going to decode every step one by one. And if you start following these steps, believe me, the systematic nature of preparing a seminar will definitely enhance your knowledge, will definitely enhance your skills of preparing the seminar. And all the MTS first year students, you have recently entered into the postgrad, from undergrad to postgrad. So you will be, it is a perfect platform for you to learn about different aspects of what is required in the post-graduation, and presenting and preparing a seminar is one of the things. So for presenting a seminar or preparing a seminar, you start with collecting the material. So these are the important resources which you need to go into to collect the material. So once you have collected the material, then comes reading part, a very important reading part. So reading, I believe, should be done in minimum of 2 phases. So definitely it's an individualistic approach, but minimum two-step reading is required, because first reading gives you an overview and perspective, and also give you an insight which book or which article will help you to create the significant content of the seminar. Like that can be the backbone of the seminar. So once you have done that, ask yourself, what is the key message behind the study? Because that will help you to interweave or weave a story for the whole seminar. And how does this relate to my clinical practice? So clinical perspective is also a must. Highlight things in your mind, absorb the flow of ideas, and then weave a story. So this is the first read. Once you are clear with the concept, add scientific evidence or articles. As I told you, you have already collected the material. So a second read helps you to clarify things better. Now you know what extra you need to search for. So the first read gave you an overview, which book will form the backbone, but now you need to add the flesh. You need to expand the seminar to make it complete, to make it holistic. So now you know what extra you need to search for. Organize things in order and pick some examples. So this is the main thing, that at least 2 reads are required. This will also give you deep insights. There are some threshold concepts which you will be able to clear once you read it more. And once the seminar, once you have read it, then the second, third stage of the crop is organize things. So you have collected the material, you have read it in detail, you know how to organize, but now the step of organizing starts. So organizing the seminar, again, it's a pyramid approach. Start from the bottom to the top. So start with an introduction in the mind. Why you are presenting? Why this topic? What of the seminar means? What is the topic? Why it is important? What should I inform to the faculty over here, or how should I present? So from the core concepts, you build the foundation. Then go to the evidence integration, that is include the articles, collect in between. So you can, while presenting the seminar in the slides, you can put the references, put the studies, put the contextual articles, then go to the clinical examples. And if there are any varied options available, any paradigm shifts available, then you can also argue on that. That is the critical appraisal I told you. So you can argue, you can contrast on things, and then add a take-home message. So this is a simple structure. For this type of structure may not be possible, or you might have to fine-tune this structure for different seminars. But this is just an overview how you have to plan a seminar. So from why, what, then how, then clinical examples along with the literature, and then varied options, and then the take-home message. So a usual seminar structure can be, I will just tell you what are the steps in that, but remember there cannot be any fixed structure. So the guidelines, the outlines can be changed for your specific seminars. So start with the title slide, introduction, history or the background, epidemiology or the importance, classification, definition, EQ pathogenesis, mechanisms, clinical features, diagnosis, management, recent advances, summary and references. Now, this is a very simple outline for a seminar. Now, this can be and should be individualized, customized depending on the topic that has been provided to you. Just have 3 checkpoints once you are present. A clarity of concept, an interwoven story should be there. You should be using an updated literature. So it's important that you go to the different articles, different journals, find on the PubMed, read them thoroughly, and try including a systematic review, because that gives an overview of what's the best evidence available, because it forms the basis of evidence-based industry. As a postgrad student, you might not be able to totally comprehend or totally able to understand what is a systematic review and how to use it, but I urge you to read in detail how to understand a systematic review, because that is the basis of the evidence-based industry, and you should try to include some points from in each seminar from a systematic review. So do remember that there are 2 different types of topic given to you as a seminar. There might be a primarily academic topic, there might be clinical oriented topic. So the basic concepts of presenting a seminar or planning a seminar will be same, but when it is a primarily academic topic or a primarily clinical topic, you don't get confused, because they have to be prepared a little different. So when it is a primarily academic topic, for example, if I give you a topic, dentinum pulpal complex, so you will write the definitions, classification of theories, mechanistic pathways, key concepts, what does the literature say, etc. So you will explain what is dentinopulpal complex, what is the importance. So it is a primarily an academic topic which forms the basis of that you have read in the organs of dental anatomy book, or in pre-operative, operative, or periodontics in the UG level. So here we want to explore your knowledge or build your knowledge on the dentinopulpal complex, but also we would like you to include some clinical concepts about why knowing about dentinopulpal complex is important. So even a primarily academic topic should be, if you should be correlating it with in a clinical manner. On the contrasting, if it is a clinical topic, for example, as an extension of a dentinopulpal complex, I might give you a seminar to a final year postgrad on deep caries excavation strategies. So this particular student who is presenting a seminar on deep caries excavation should already know what is dentinopulpal complex and what are the strategies for deep caries excavation based on the anatomy or histopathology of the dentinopulpal complex. So the concepts about clinical techniques, the seminar would include core concepts, mechanistic pathways, clinical concepts, key paradigm shifts. What does the literature say? So for an academic topic, you should be able to correlate it with the clinical knowledge that is translatable from the academic. And for a clinical topic, you have to present the background of the academics. So do remember, there is academic clinical synergy in all the topics. For an academic topic, you cannot skip the clinical applications or clinical implications. And for a clinical topic, you cannot skip the academic basis. So this is very, very important slide or very, very important concept, that for different seminars, you cannot just focus on if the seminar is provided on, suppose, anatomy of some anatomical concept. So just don't focus on that. Also focus on what are the clinical implications of learning that anatomy. If I say you anatomy of mandible, then you have to focus on all the foramina and then tell me these are the foramina required for the local anesthetic application and how these things change. And if it is about something clinical topic, do develop the concepts by giving a small background of the primarily academic concepts. But as a student, you should be knowing everything. So even if you're covering 1 or 2 slides, but we would think that you already know the basic concepts. So even in the Bloom's taxonomy, we understand or we comprehend that the understanding, remembering, and applying, these were the concepts. These are the 3 things that you have already covered in undergrad level. So you should be knowing that. So if you are not very well versed about that topic, it is your duty to understand, read, organize things in your mind in a very clear manner, and then build concepts which are required as a postgrad student. Now, after collecting the material, reading the material, organizing the things, now comes preparing the slides. So is it easy or difficult? So it is both. For a student who is tech savvy, it might seem easy. For a student who is not very tech savvy, it might seem a little difficult. But I am sure that this generation, which we call as Generation Z, is usually very tech savvy and find preparing the slides easy. So MS PowerPoint, you have to learn this. If you don't know this, there are other tools too. But primarily in most of the colleges, we usually follow MS PowerPoint. So use a simple professional template with the white, blue, or soothing backgrounds. So there is not much need of using so much designs in that, because we want to assess your knowledge. We want to build your knowledge through these seminars. So it is for your learning. It is not for your teaching skills. It is for your learning skills. We are giving you seminars so that you can prepare better, so that you collect the material so you can read. We don't want that learning from your side. It is for you to learn, and then we just help you to organize your thoughts better. We help you to by asking questions, by giving our own inputs, by providing you deep insights, by guiding you which book to follow, by guiding you which article would be good. So we just help you in making a good postgrad student. So if you're using any design, the space utilization should be maximum. Use large fonts with contrasting and easy to read colors. Usually sharp red and sharp green colors should be avoided. And red is, from my side, red is completely no. You can use 6 to 6 by 6 rule. That means 6 bullet points per slide, 6 words in each line. So you can see even in this slide, 1, 2, 3, 4, 5, and 6. So 6 lines. So you can see that the slide is very clear. I used minimal animations. It was not very flowing animation, so it was a very easy slide to understand. So prepare slides. Avoid clutter, very important. Use visuals. You can appreciate the difference. You can use diagrams, flow charts, clinical pictures. Very, very important. If the case is done by you, you can put it over in that seminar. But if you have taken the image from someone else, you have to quote the reference. It may be through an article, maybe your senior pictures, maybe someone has done a case in your own department or your colleague. Just quote the reference. Keep animations minimal unless you feel you are an expert in it. Avoid distracting, spinning, or flying text. Follow a theme. This is a very important point. I always say that your seminar should follow a theme. Now that theme will be clear to you, or that story will be clear to you if you have read it at least twice, and in your mind you are very clear about the whole concepts. So after collecting then reading is very important, organizing plays a very good role, and then preparing the slide. So you cannot skip any step from crop. So avoid redundancy. What is the meaning of redundancy? Avoid duplicacy. So you don't use the same information again and again. So use a theme, but avoid redundancy in the slides. Effective use of images. Visuals help memory and understanding. We all know that. Use clinical pictures, as in the last slide I told you, diagrams and flowcharts. Never copy images unless understand and explain them. But if you copy, then do cite reference. Otherwise, it's a blatant plagiarism. Always cite resources. So this is also a screenshot. So you can say that it is an image. So if you are writing something on microbial ecology, you can take a screenshot from the PubMed and put it over here. But don't you think it is very boring? In spite of that, you could have read this in detail and maybe made a slide with only 2 text messages from all this information. But as a student, I would even want you to go further. Go to the article and choose one diagram. Now, this diagram explains the complete concept. And rather than these 2 first concepts, I would be very happy if you use this diagram and explain me the concept, how this ecological shift is leading to a clinical caries. So in spite of making the cut, copy, paste or diagrams which are meaningless, which are very complex to understand, and try to make very picturesque and try to explain the things thoroughly. If you are using the clinical images from some other article, I just quoted my own article. So if you are choosing this, just quote it appropriately in your seminar. So data and graphs. Use graphs and tables only if they add meaning. It's a seminar, it's not a journal club. If it's a journal club, you have to add the graphs and tables depending upon what journal club and what is the need of that. So you can use meaningful pics as screenshots. But of course, in some seminars, you can include some tables or graphs from the articles also, but meaningful, and then you can take a screenshot. But add a reference. Avoid screenshots of big tables. So if it is a very big table, avoid screenshots. Rather, it's if necessary, you can use the relevant information from data tables. So, for example, if you are preparing a seminar on the vital pulse therapies, you can use this bar graph or you can use this network meta-analysis plot. Which one is easy to understand? As a student, you might think that this bar chart is easy to understand, but once you are able to understand this, then you will then you know that all the information over here can be easily explained by these simple vertical lines. So no doubt, as a first year student, you might not be able to understand this, and you will be more easy to include this. But this shift should be happening from first year to final year. So as a first year student, even if you are adding some lines from that article, that's fine. As a second year student, if you are including this bar graph and explaining these bar graphs appropriately, that's also okay. But as a final year student, as a person who is able to now critically appraise things, I would be very happy if you don't include all the unnecessary information from the article, just because all the information from such an article, it can be summarized in only this diagram. So nothing else is required from the whole article if you are able to explain me this chart. So data and graphs should be included when relevant, not always required in a seminar, but if required, if included, they should be meaningful, thoroughly explained. Now UG level versus PG level seminar, very important slide. Now you have shifted from UG to PG. Why and why your seminar level should not change? They should change. I showed you Bloom's taxonomy. You should be critically praising the concepts. For example, if as a undergrad level, you are preparing a seminar on dental trauma, then these are the concepts that you will include. What is trauma? What is its epidemiology? What are the causes? What is the classification? Management strategies, prognosis, no reference and no source cited. So that's okay. So, but when you come to PG level, I really need you to critically appraise the whole topic. So add up some basic knowledge, Begin with epidemiological concept, prevalence, age group most affected, add references, detail the classification systems, detail old classification systems, pros and cons, integrate management protocols with decision-making flowcharts, Not only management, what is management as you included in the UG level, but now include the detailed protocols with decision making flow charts, because it's a higher level thinking. So you are shifting from undergrad to postgrad level thinking. So your thinking skills should improve. Your critical appraisal should improve. Support every section with recent evidence and guidelines. Include prognostic factors, follow-up factors, complications, add critical insights, add controversies, add clinical correlations. Appropriately cite using a Vancouver style or Harvard style of reference. So you can see how a simple example of dental trauma, you can prepare a seminar which you think it is good, but when the faculty would hear, they will really think that it is an undergrad level and you should improve your skills to a postgrad level. But if you include all these concepts, then your seminar level will be a true PG level seminar. Do remember, the ultimate thing is to reach a stage where you are able to critically appraise everything. So another example, let's imagine example of an incomplete information in a slide. Incomplete information as a PG student. So let's imagine you are provided a seminar on ECC. Now, globally, ECC a highly prevalent disease, is a high. So you might think that including this line is sufficiently okay, because your seminar is on ECC, so you will start with the prevalent, it's a prevalent disease. But don't you think that I can expand this line rather than simply quoting this? I can write a meta-analysis of studies from cross-sectional studies using the WHO criteria shows prevalence of ECC to be 48%. How informative, and including the 95% confidence intervals. How informative is this line as a PG level? It tells you everything. It tells you that it is the information taken from a meta-analysis. That means all the systematic reviews have already, all the clinical original research has already been summarized using the WHO criteria. So it already tells you that WHO criteria was used as the threshold for the detection of caries. It tells you the prevalence, not only that it is a highly prevalent disease, it also tells you the 95% confidence. Now, this particular line including is definitely good as a PG level, but adding a reference adds to the quality of the seminar. In addition to that, if I also add the Indian scenario, I shift from global to the Indian scenario. So I will telling the prevalence of the ECC in the global scenario and then add the Indian scenario. So another systematic review from an Indian study has shown the pooled prevalence of ECC to be 46.9%. And then also add a reference. Now I think I don't need to comment on anything. You can yourself think which will be the best schemata or best scheme for presenting a seminar on ECC as a postgrad student. So don't focus on just including some lines, but expand the lines, take the literature, read the literature, organize the things, and then plan the seminar. Just don't start preparing the slide from the day one you're provided the seminar. No visual content in the slide. Let's take an concept one that you are provided a topic, something on behavior management, and you are making your slide. Suppose you included this. Dental anxiety is one of the main problems dentists may face during the treatment of pediatric dental patients. Therefore, clinicians tend to perform different behavior management techniques to reduce dental anxiety in children. So a long line in a poor color, just copied and paste. How many words are unnecessarily included in this? So as a student, you might think that what's wrong in this? But this information, once this particular slide will come when you're presenting a seminar, you will be forced to just read it. You will not be able to explain the concept. Rather, if you just omit all the waste words and just make it a summary of this, like this, dental anxiety, a common problem that we face in our daily practice, it requires different behavior management strategies. So how beautifully the top 3 lines written in a monotone color can be changed into a very good, impressive color and clear concept. So if you just write some concepts, then you can also explain these concepts in a better way while presenting a seminar. Now, concept 2, a number of non-pharmacological, behavioral and cognitive techniques that can be used in the dental clinical surgery in order to assist anxious individuals obtain needed So again, copy and paste. Theoretically, it might seem okay. Every word is making a meaning, but during the seminar, it will waste your time. The color scheme is not good. The lines are very long. The message will not be very clear. That means shorten it. Non-pharmacological strategies include behavioral and cognitive techniques. Finish. So you have to make slides in a manner by which the complete story that is woven in your mind is thoroughly being explained in the minimum possible words using a 6x6 rule, 6 lines in one slide, 6 words in one line. More than that, plus minus 1 or 2 is okay. But if you think it is important to include more words, then go add a slide. Don't clutter the slides with many things in one slide. How to structure the seminar? So we have completed that. Now after preparing the slides, we have to present the seminar. So collecting the material, reading it at least twice, organizing things using the pyramid manner, and do remember academic and clinical synergy in the seminars. You have to prepare the slides and then present the slides. Present the seminar. Two things are very important: time management and body language. So before presenting the seminar, I urge everyone to rehearse before you present. Yeah. Even for recording the slides, I prepared the slides and then I rehearsed twice before I am recording the slides. So it's important for us to rehearse. So aim to complete the seminar within the time allotted. 1 to 2 minutes for each slide usually takes, but varies from individual to individual. So 1 to 2 minutes if you are explaining the concept, if you are following a 6x6 rule. Rehearse to ensure that you can speak well and cover the seminar within allotted time. That's very important. Body language. Now, this is one of the soft skills that you will learn by presenting the seminar. Maintain the eye contact, leaves a good impression. Use open gestures and posture. Positive body language is the key. Vary the tone, avoid the monotony. Pause for emphasis. So it's important. These are the soft skills that you learn during presenting the seminar. How to handle the question and answer. So once you have presented the seminar, usually the faculty and other students might ask some questions. The intent of asking a question is to assess the depth of your knowledge and also to give you a overview of or a reflection moment. Where do you stand or what else do you need to know? So the questions are asked usually about the topic or something relevant to the topic. So I told you, if it is a clinical topic, you might be asked academic background. If it is an academic topic, you might be asked clinical interpretation. Do remember common things about the uncommon disease and the uncommon things about the common disease are very frequently asked. If you know the answer, take a pause, structure the answer in your mind and then reply. You can also critique, very important, you can also critique the question and provide an opposing view, but then you should be able to quote the reference. Many times questions are focused on concepts, clinical applications, some updated literature and background knowledge that the teacher feels you should know. So here again, the concept of academic clinical synergy comes. We might ask an overlapping question because we take it into consideration that you already have some basic background knowledge about the topic. So if you don't know the answer, you can answer next time, but you can follow the departmental protocols, but it should not happen for all the questions which are being asked. Self-evaluation or reflection. It's a very important thing that once you finish this, you have completed the seminar, after coming back to your room or the clinics, you should reflect. What is the meaning of reflection? You should reflect on what went well, because that's the positive reflection for your own optimizing your own performance throughout life. What could have been improved? What could you have done better to make it a good seminar or a better seminar than before? Note the suggestions provided by the teachers or someone else. You can also take perspective from different students. How did it go? Make a note of all the questions and suggestions and try to include them in your next seminar or improve the way of style of presenting the seminar. Now, some common mistakes. The most blatant mistake is presenting one other seminar, taking from SlideShare, from Telegram portal or from Google. Just don't do that because you will not be able to learn anything. Present a little average seminar, little poor seminar, but prepare yourself. Copy and paste in the slides without appropriate referencing. So the first thing is that you should not copy and paste. You should read, make your own statements. Still, you can reference them because the concept is taken from some other already published articles. Slides loaded with text. Again, as a student, you should be using minimal possible text. I understand there is a learning curve for that, but minimal possible text will be fine. Not understanding the topic, just presenting for the sake of it. Many a times we see that student is provided with a topic, so he just copy paste or just make a seminar and then just present it, and not aware of what is the topic, how it is to be dealt with. So it's not a good habit. So not done the appropriate literature search, missing the updated concepts, and so presenting older concepts is also not a good thing. So not rehearsed well, reading the slides. So sometimes we see the students just read the slides as such. No pause, no emphasis, nothing. So that's not a good idea. Spelling and grammatical mistakes in the slides can put off the audience and lead to a poor assessment score. Very important. It is your slide. It's your duty that they are grammatically okay, that there are no spelling mistakes, that your pronunciation is good. So do remember that rehearsing and reading slides before you present on the day of seminar is very important. So poor color scheme also is very, very common mistake. So these are the common mistakes. So my take home message is only one: don't copy and paste. Learn to crop T. Read, organize, prepare the slides, then present the seminar. With these words, I once again thanks the organizing team and the chairpersons for giving me this opportunity to present this seminar. I am on all the social media portals, so if any one of you want to connect with me for any specific query or anything in the field of pediatric dentistry, I'll be happy to help. So with these words, once again, thanks and thank you for patient listening.
Thank you, sir, for your insight and a wonderful presentation on and a detailed presentation on insight on presentations. From the era of overhead projectors and writing up the cellophane sheets to the current AI, sir is the master. And if anyone in the group have any kind of questions, the floor is open for questions. So I see there is no questions as such. Yeah.
Typical first years are attending, sir. They don't open their mouth for the first 6 months.
They have not yet gone to any seminars.
When we see the learning pyramid by the Edgar data, the 35% of the learning happens in the first three from the seminars up to the seminars. So the take home for all the freshers are, this is the nobody better than Neeraj sir can explain about AI as well as including from the scratch, that is the crop technology and the 6x6, and it is one of the amazing way of gathering knowledge as well as putting it as a presentation. Creating a seminar is a work is the backbone of those who want to be a successful clinician. The impact of poor seminars would reflect in your clinical implementations. So saying this, I thank Dr. Neeraj sir for his time and a platform given by ISPPD and Subbalakshmi madam and its organization in making this to reach out to all the first years, and they are blessed onto this.
Thank you, Chandan sir. Thank you
for your wonderful presentation. It's actually very well prepared and rehearsed, and hope our students will also do that. And thanks Subbalakshmi and ISPPD for providing me this opportunity. Yes, sir. You want to say something, sir? Neeraj, sir?
Just wanted to convey my sincere thanks once again to ISPPD head office, Dr. Virender Goyal sir, Shashi sir, and everyone at the ISPPD head office, and Dr. Subba Lakshmi ma'am, her team, and Dr. Farzan and Dr. Chandan as our chairperson. Thank you and best wishes to all the postgrad students.
Thank you, sir, for the enriching talk, and thank you to our moderators for their smooth coordination. I now request the moderators to present the certificate to the speaker.
Thank you.
Sir, kindly accept the certificate from ISPPD
Thank you.
and the
Thanks a
organizers.
lot.
Thank you, sir. We will now present the certificates to our moderators. Certificate of appreciation to Dr. Chandan GD, sir, and Dr.
Thank you very
J.M.
much.
Farsan, sir.
Thank you. Thank you so much.
The next session is on journal clubs for postgraduates by Dr. Vijay Prakash Mathur, sir. Our moderators for this session are Dr. Faisal CP. Sir is a professor and head of the Department of Pediatric and Preventive Dentistry, Kannur Dental College, Kerala. Sir is also the Vice President of ISPPD. And I welcome sir.
Yeah, good morning.
Next moderator is Dr. Bhavna Dave, ma'am, Professor and Head of the Department of Pediatric and Preventive Dentistry, Sumandip Vidyapith University, Vadodara. She also serves as Executive Committee member of ISPPD. I welcome you, ma'am. I now invite them to take over the session.
Yes,
Hello.
Am I audible?
Yes, ma'am, we can hear you, ma'am.
Okay. Good morning and warm welcome to Professor and Head of AIMS, New Delhi, Dr. Vijay Prakash Mathur. He received prestigious Commonwealth Academic Fellowship in year 2014 to University College London. He has been awarded with Founder President Award of Indian Society for Dental Research and Dr. J.G. Kanappan Award for Maximum Citation. He has around 213 publications and contributions in the books. His citations have reached 2,474 with H index of 28 and I-10 index of 56. He has presented more than 430 papers in the international and national prestigious conferences. He has been part of about 45 research projects funded by different organizations, and area of interest is special healthcare need children, soft tissue lasers, dental traumatology, early childhood caries, health-related quality of life, biomedical research ethics, national programs, policies, and implementation. Actually, sir has been doing this journal club presentations, and even I have attended, I think, quite some time back. But he is a wonderful orator, and I think the students will take a lot of take-home message today from sir. Sir, continue, please.
Good afternoon, everyone. Sir has suddenly had an important government meeting to attend. But Sir has sent us the presentation. So we'll be playing the presentation, a recording of the video now. And any questions, Sir will be available to answer them at a later stage. Thank you. So we will go ahead and play the video.
Journal is actually reading between the lines, and as I've written here, I do come to attention. A very good morning. Thank you very much to the ISPPD head office and the organizers for inviting me for this very important part of the teaching learning in the postgraduate education. The title Journal Club is actually reading between the lines. And as I've written here, I do come from All India Institute of Medical Sciences, New Delhi. What is Journal Club? It's a group meeting to critically appraise the recent research articles. It encourages the evidence-based learning and discussion. It helps in developing the reading, presentation, and analytical skills. The objectives of a journal club are normally promote critical appraisal skills among the postgraduates, keep them updated with the current literature, improve scientific communication, and foster the evidence-based clinical practice. In case of our specialty, because we are rapidly evolving science, wherein there are changes every day in the behavior management part, especially with reference to the changing parenting styles in the modern living styles, the changes in the preventive dentistry and recent advances in pulse therapy, trauma management, etc. So we need to do journal clubs very regularly. It also helps us to evaluate new materials and techniques in our branch, and it also encourages some of us to orient themselves towards a good quality research. So now when we come to the steps in a journal club, so first is that selection of articles should be done, and then we should be presenting with the background and rationale of that study, then methodology with its critique, then the results and the discussion. They may not be that elaborate, but yes, results, the part are important. The clinical relevance of what has been studied and what are the conclusions. And then there should be open discussion and summary. And along with open discussion, we should also do a critical evaluation of the article. So selecting the right article, normally, although in my institute it is generally allotted by the faculty, but if in your institute, if it is to be chosen by you, but try and seek guidance from the faculty and seniors. Prefer the recent last 5 years relevant studies. Prefer doing on controlled clinical trials, systematic reviews, and meta-analysis. Although some of the very important case reports can also go along, and some other studies which are qualitative in nature, they may also be relevant to us. We should also see the relevance of the article in terms of whatever the current problems in clinical or public health related issues in pediatric dentistry, and sometimes it is very important to do an article journal club on which is related to your thesis. So with that, if you get a very good article, then what next? For example, your structure may start with the topic. The first slide may have topic, the details of the journal, which year it was published, which issue it was published. Then there should be 1 or 2 lines about the journals, which journal it is, which society is publishing, which country it is, and if there is something more specific about that journal, you can also speak. Then there should be something about authors, not only the names, but if there is something important about that author group, that they are doing a kind of research or in this field for so many years, or an institution which has been doing this particular type of work for a long time. So we should be speaking something more than what is written in the article. For that, we may need to search more. Then we should talk about what is the study type which you are trying to cover in this, and then why you are covered, why the outcome of the study which you are covering in the journal club has got a significance in terms of your department or your thesis or your clinical practice, whichever way it is. But some significance should be mentioned in the first slide. You may not write, but you should speak out. So, for example, this is one of the article which was published in Pediatric Dentistry in 2024. And you see the topic, Artificial Intelligence in ECC Detection and Prediction. This is the most recent topic, most upcoming thing everywhere in the world. Everything around us is now going towards AI. So this is the kind of thing which we should be choosing. Then we should also put it that this particular journal is the official publication of so-and-so academy or society. If the impact factor values of that journal are available, we should always mention that. Here I missed writing the impact factor. Along with that, in bracket, we should be writing the year for which this impact factor value was given. Then we should also be giving some keywords, like for this article, the keywords were artificial intelligence, caries detection, deep learning, pediatric dentistry, and pedodontics. The author details can be given like their designations. Along with that, so for this particular article, it was not found much that these people have been already doing in some particular direction, so it is not mentioned. But yes, if their photographs are available, if their nationality or the university, the details are available, that should be mentioned. Now, preparing for JC. So, first rule is read it twice before marking anything. Try to understand. In the third reading, try to mark the important points in that journal. You may use a highlighter, or if you are doing digital, even digital highlighting can be done. Then after that, try to write the summary in your own words. Do not try to copy paste the text directly from that article to your slides. Write in your own words. Yes, specific things like citation of the journal or the tables, they need to be copied, but rest of the things should be in your own words. Prepare the framework of the presentation. Show the framework to your seniors and faculty. Once they approve it, start entering the text into the framework. Read the complete article again. Then try to do the critical appraisal based on the requirement for that particular study that I'll be covering a little later. Now, during presentation, your introduction should not comprise more than 2 to 3 slides. Sometimes a very simple topic, you may complete the introduction within half a paragraph. But if it is new, like for this particular example which I have given, for AI, yes, it is needed to introduce how much AI has already done. And if some work in this particular area of AI has been done, that also needs. So in my case, for this particular article, I would cover 2 to 3 slides for introduction. However, if it is something related to pulp therapy, which you already know, so you may finish the introduction in half a paragraph, and then you can directly jump to the type of study design and then the methodology. Methodology sometimes require elaborate details, it may require 5-6 slides. Sometimes if its standard methodology has been used, you may say that using the standard methodology of isolation, local anesthesia, root canal treatment was done. So in that case, you may not elaborate, only you can elaborate on what was examined, which index was used to examine, which kind of X-ray was done. So as appropriate, you have to cover the methodology. Then results. Many times we see in many of the articles, some of the tables which are given, they may not be relevant to the primary objective. They give unnecessary details. So please restrict yourself to the primary objective, or if there is some very, very important secondary objective, then relate and then present those. Otherwise, restrict yourself to the relevant tables. The discussion which the author has presented, you have to present it from your perspective. So you can present in the discussion in brief, saying that the author has justified so and so step by this or so and so results by using this example. However, the actual discussion which you are supposed to do is a part of critical appraisal. The conclusion should be mentioned verbatim, and we should always recheck with the primary objective if the conclusions are answering the primary objective or not. And then after that, critical appraisal. Critical appraisal, I have used a small acronym for strengths, weaknesses, opportunities, and threats, SWOT. Actually, this is the technical term which mostly the management people use. But for you, critical appraisal does not only mean the strength and limitation of the study. For here, we should also think about the future directions. And if this particular research has taken in a wrong direction, then also we should mention. So for us, O and T are little different, but these are required in case of our journal club. In the methodology, we should always mention with the first line, the study design, qualitative or quantitative. We should mention which was the population used, what was the sampling method, if there was randomization, how randomization was used. You may not elaborate, you may right, which method of randomization was used. If something related to ethical, we should mention. If it was very, very generic, you may skip that part. But you have to critically see that whichever data are being recorded, can they be falsified? Is there a objectivized method of recording them? Or if it is a subjective recording, then was there a standardization? Was there a training and calibration of the examiner? And we have to see whether this part of the methodology can be replicated or not. So these may not be written per se directly, but you have to critically evaluate in the methodology while presenting the methodology. And if you find that they use one particular method of recording, like dental caries, they use DMFT. And if you opine that in this case, ICDAS could have been better, then at that time only you should be speaking. Although the authors use so and so index, but this could have been better. So that way you do some part of the critical evaluation at the time of presenting methodology only. Then the critical appraisal, you talk about, was the study design appropriate? Was the sample size appropriate? Was the population selection was appropriate? Was the randomization appropriate? Intervention and comparison, if there was anything lacking, the outcome measures, how that could have been better. Statistical analysis, if required, we speak about that, but speak about bias and limitations of the study. Now there are some presentation tips for you people. While making slides, just imagine my slides, they are very clear visuals, they're very concise slides, they are bulleted points, enough margin has been left. So make clear visuals and concise slides. Try to highlight key points from methods and results. Try to do some engagement by asking questions or talking in a way that you're talking to them, not only reading from your slides. Then try to speak out in such a way that it relates to your clinical practice or your thesis or something important which you are doing. It should not be just like a presentation, it should be related. Now during presentation, please encourage the evidence-based debate. If the debate is going somewhere else, please try to restrict that. Respect the different viewpoints of your colleagues or your seniors. Summarize the take-home messages at the end of the presentation. And if you got some feedback from your faculty or the seniors, which was lacking, please document that, try to redo. And at least if you are not given another chance of presenting that, at least you do yourself your homework as your add-on work. It will be helpful you for preparation of your exam, the final exam. Now the word which I've been using time and again during the presentation was critical appraisal. Critical appraisal is actually critically reviewing at it. Now there could be a systematic method of doing critical appraisal. So based on the type of study, some of the groups and some of the universities have come up with different study tools. So these are the four groups I have written here, which they have given different tools. So although the number of tools for different study designs are innumerable, it is difficult to mention them in one presentation. But yes, commonly used ones for our purpose, for systematic reviews, we should be using MSTAR for assessment of multiple systematic reviews. It is a 37-item tool. For finding out risk of bias in systematic reviews, ROBIS is one of the tools. To present randomized control trials and do the critical review, there can be Cochrane risk of bias tool or there can be consort statement. We are commonly using consort, but Cochrane risk of bias is nearly the same, a little more critical. In case of observational studies, we have STROBE, strengthening the reporting of observational studies in epidemiology. And there is one Newcastle-Ottawa scale also. And then some other study types like GRADE and AGRI, they are also there. In fact, our colleagues in endodontics, they have also come up with some guidelines for reporting of case reports, and that is applicable to our pediatric dentistry. So there are some are the reporting guidelines, some are risk of bias assessment, and some are critical evaluation tools. So whichever is appropriate for a study, you should use this. Now presenting the critical appraisal also can be done either you present it at the time of presentation as soon as the introduction finished, you complete the introduction related parts, those 2-3 questions related to introduction, you do it there and then. And some of the universities, some of the departments, they prefer doing it at the end. And at that point of time, the author need to remember and repeat that this part was lacking in introduction or this was covered this way in introduction. So both the ways are agreeable. Whichever way your department follows, please try to do. But critical appraisal of the article will make the actual learning from that article for you. Like this is one of the example. This is one of study presented in my department by one of my junior colleague. So they have presented like this, the journal, which year published, the author names, keywords, and then this was the reporting tool. So this had got so many questions for next 2-3 pages. So this is one of the way of presenting these 25 questions. The same study, they also used the JVI critical appraisal checklist, which was for randomized control trials. Another study again by another colleague of mine in the department, they presented it in a little different way, that introduction to the authors, and then this was the stroke statement for that particular observational study. So this way you can do. So with that, limitations, unanswered questions should be talked about. What can be the other perspectives and what can be the counter arguments? These all are required. These all will mature you as a learner. These all will mature you as a scientist, and maybe you can become a better researcher if you do a good journal club. The challenges mostly in our specialty in the journal club are passive participation of the people. Sometimes there is poor article selection, you do not consult. Sometimes we take this as granted. The statistics, something is mentioned and we are not expert in that. But I'll suggest you that please talk to a statistician and present it. That will enhance your learning. And sometimes our head of the department or the faculty, those who are sitting in the journal club, they'll say you have to finish in 30 minutes. Then your critical appraisal is the thing which is actually most hampered in those cases when there is a time constraint. Suddenly the patients will start coming, you had a class in the morning and you have to leave in between. So these are some limitations, but yes, we have to find out the ways and means to overcome those challenges. For engaging the audience, we can use several things. We may do case-based discussions. We may relate the research to patient care, as I mentioned before. Sometimes you can add polls or quiz questions, which you have already done. That was this methodology correct for this case? You can ask question to the audience and then you can show, no, this was correct or this was incorrect, whichever way it is. And if there are some short videos and visuals which are relevant to this particular study, you can show them. In fact, one of my colleagues always does a video showing the location, geographical map and location of that university, where it is located. Even that also engages the audience in a better way. So now the last part is for the faculty members, those who are attending this program. Your role, as a mentor is you help them in good article selection. You help them in learning the critical thinking. You provide them the honest feedback on their presentation skills at the end, and give them some model ethical discussion, moderate some discussion on ethical part, and if you have some more references to speak about, please speak and make learning better for your department. So an outcome of a good journal club is better understanding of the research, improved evidence-based decision making, enhanced confidence in literature review and thesis work. With that, I want to also give one more example. In my department, we had one time a discussion that the etching time on the teeth, how do we calculate the time precisely, 15 seconds or 20 seconds? And then how does it matter if it is less by 2 seconds or more by 2 seconds? And then we tried to search for the literature and finally we ended up doing a study on that. So this way, the things keep on happening. Sometimes we end up writing a letter to editor because that particular article had so many things which could have been improved. And remember, whenever you are planning a letter to editor, please do not use derogatory language. Be suggestive in nature, respect others, And even if there is something lacking in some of the articles written by another colleague in another university, you still need to respect them, whatever they have done. Thank you very much.
Thank you, Dr. Vijay, for your insightful talk on how to present a journal club. I'm sure that Dr. Vijay Mathu's practical thoughts would enable the postgraduates critical thinking and evidence-based education. Unfortunately, Dr. Vijay is not online here with us today. I think you can take your questions. I can put your questions in the chat box. We will forward it to Dr. Vijay.
I think being first years, there are very minimal questions or rather less number of questions. Ma'am, your thoughts, ma'am?
They have not yet done any journal club as of now.
That's what.
So, and the way sir explained all the tools regarding the appraisal and critically evaluating the article is very, very briefly he has said, but then it is very important. If the student can learn it little more and go about it, it will be definitely helpful to them. And I think this is the right way of going for the journal clubs for the faculties and the students.
Faculties also have got a great role to play in journal clubs.
Yes, that's what he explained. And that's really good. Thank you so much, Dr. Subbalakshmi, for giving me this opportunity to moderate this session. And I'm thankful to ISPPD for giving this beautiful program for the first time. And it's really very, very wonderful program because it was needed. And it's a very good thought by the ISPPD to have conduct this program. And I'm very happy. Yes, I'm very happy that ISPPD has got the international platform now, and it's going to be wonderful. And Dr. Virinder sir has got this opportunity, and is going to become the president. It's a great opportunity for ISPPD and all the pediatric dentists across India. Thank you so much.
Thank you, ISPPD, and thank you, Dr. Subbalakshmi, for giving me a platform to moderate this session. Thank you, Ananda.
Thank you.
Thank you so much, sir, for that valuable session, and gratitude to our moderators for their insightful remarks. I now request our moderators to present the certificate to the speaker.
In absentia, over to Dr. Vijay Mathur.
Thank you. And now we'll present the certificates to our moderators, Dr. Bhavana Devi ma'am and Dr. Faisal sir.
Thank you so much. Thank you.
Thank you, sir. Thank you, ma'am.
We now have the final session for the day on conference papers and posters by Dr. Mahesh Ramakrishnan sir. Our moderators for this session is Dr. Virat Galhotra, Professor and HOD of the Department of Pediatric and Preventive Dentistry at AIIMS Raipur, and he is also the Associate Editor of ISPPD. The other moderator for today is Dr. Suresh B.S. Sir is a Professor and Head of the Department of Pediatric and Preventive Dentistry at Subbiah Institute of Dental Sciences, Shimoga, and he is the Executive Committee member of ISPPD. Sir was supposed to be with us, but for some unavoidable reasons, he is not here. So I request Dr. Virat Galhotra sir to guide the proceedings.
Yeah, good afternoon, everyone. First of all, congratulations, Varinder sir, and congratulations to you, Dr. Subbalakshmi, for conducting this first ever National Post-Graduation Orientation Program. And it's an honor to introduce Dr. Mahesh Ramakrishna. He is Professor and Head Academics and also Associate Dean of Hospital Administration, Department of Periodontics and Preventive Dentistry, Savita Dental College and Hospitals. He is a Principal Assessor for National Accreditation Board for Hospitals and Healthcare Providers. And he is also an executive member for Indian Society of Pediatric and Preventive Dentistry. And over to you, Dr. Mahesh.
Thank you, sir. Thank you.
To thank ISPPD and Dr. Subbalakshmi for giving me an opportunity to share my experience with the new pediodontist in town. The program is a great initiative from ISPPD to orient the new first-year postgraduate students into the curriculum of pediatric dentistry. Moving to my topic of presentation today, my topic will mainly focus on what is the benefit of attending a conference, what is meant by a conference paper and a poster presentation, basic guidelines when you plan for a paper and the poster presentation, and how much the maximum you can utilize by attending a conference. So my presentation is titled as Conference Paper and Poster Presentations, a gateway for the academic excellence for the postgraduate. So moving to today's introduction, usually conferences schedules are released at least a prior of 2 weeks before the dates, so that you will have an opportunity to identify who are all the presenters from various colleges who is talking on your topic of interest. So mark all those presentations, attend those lectures, interact with them, share your research ideas so that you will get a constructive feedback, the difficulties which they encountered when they planned up for the study, so that you can plan accordingly when you plan for your research topics. So each PGs are mandatory that you attend a certain number of conferences in your 3 years of post-graduation. You have to present a minimum number of posters and papers in the 3 years of your PG life. So our society gives you a platform of 1 conferences and 1 convention per year. Usually the first year students are made to present a poster. In the second and third years, you will get an opportunity to present as a paper presentation. So how can a conference is more important to a postgraduate students? The conferences can be both fun and informative. You will get an opportunity to meet more than 1,500 pediatric dentists, postgraduate students from all over India, starting from Kanyakumari to Kashmir. So in a good sense, you will meet a lot of different people who's got more broad perception of your research. When you get engaged to them, it helps you in complete critical thinking for your research topic, and they can help you out in tracing the key articles, the materials which they used for the research, the in vitro planning, where the test study was actually done, the difficulties which they can encounter during the course of the research preparation, so that you will tend to make newer ideas, and then you can explore the other possible opportunities before you plan for any kind of studies. And then most of this presentation will help you out in innovating newer topics, in collaborating yourself with the other college postgraduate students, so that it helps you out in your career profile and your motivations. So the types of conference presentations, our ISPPD will give you 5 basic types of conference presentations. So it can start from the paper presentation, poster presentations, it can be a symposium or a panel discussion, workshops, pre and the post conference workshop, or it can be a video presentation or a reel presentation to showcase your other skills. So talking about the importance of paper presentations, that will help you to demonstrate a complete depth of your subject. It improves your public speaking skills and your defense skills also, which will be useful throughout your postgraduate life. When you meet someone who works on the similar topics, you have an opportunity to collaborate with them and also publish their findings along with yourself. And it helps you to get more organized and constructive feedbacks for your research planning before you actually start doing some kind of. Importance of poster presentations include, the poster presentations are mostly for your first year postgraduate students.
It encourages your visual communication skills. It's more ideal for the earlier start of the career. So you design your poster, explain them in a small group of audience. So it promotes one-to-one discussion. So it makes you far more confident when you present as a paper in your second year to a much bigger crowd. So it is like a stepping stone for your presentation journey. So moving to the guidelines of your paper presentation, usually in a conference, the conference organizers will give you a set of guidelines before you start applying for a paper presentation. But the general guidelines include, you always start with an introduction explaining why the particular research was done, what was the lacunae from the previous research, what is the aim of your study, aim and objective of your research which you have planned, and then followed by the methodology. Methodology in the sense, how was your study done? What steps did you follow in your study? What was your sample size calculation? How were the sample size you arrived at that? And what are all the parameters you explained, you identified in your research? What criteria did you use for your studies? So these forms the basic methodology of your studies. And then followed by a result. Result in the sense, what is the final results of your study? What did you conclude from your study? So these are the basic things which you have to follow for any paper presentation. So when you prepare your slides, make sure that the slides are more clear, concise and more visually for the crowd, so that it makes the crowd to understand how the study is planned, why there is a need for that particular study, and what was the result of your study, and then your conclusion. So make these slides at least a week prior for your presentation so that you have enough time to practice it. And finally, you can handle the questions in a much more confident way. When we talk about the sequence in a research paper presentation, the first thing is your introduction, which is going to explain the need for your study, why the particular study was planned. If there was a previous study published on that particular topic, what was the lacunae of the previous study, and what made you to what changes on your particular study, and what was the aim and objective of your study which was planned. And then your methodology in the sense, how the study was done, how the sample size was calculated. Either it can be a cross-sectional study or a cohort study or a case control study. What kind of study it was, what was planned, whether it is registered on some CTRI, and what methodology did you follow, what is the criteria you used for evaluation, how the data collection process is done, and what samples, what was the biostatics text which you done for the particular study. So it explains the complete methodology which you have followed in the study. And then you will have to talk more on your research finding. What was the conclusion of your research? So the research findings can be explained in as a tables or a graph, so that the listener is going to be more engaged in your identifying your particular research from your study. Conclusion is the main summary of what was the significant finding of a study, whether there is any significant finding which you have identified from your study. So the key finding of a research is usually explained in the conclusion. And then if you talk about after you conclude, then usually the conference organizations give you a time frame of 8 minutes for your presentation and 2 minutes for your question and answer sessions. So once you answer all these questions, don't forget to acknowledge the people behind your research. And when you plan for research publication, these are the 10 basic commandments for a clear presentation. The key points include that your presentation should be more clear, it should be more concise presentation, explain the audience more clearly that what you have identified from that particular, what was the need for the particular study, what methodology did you follow, and what was your result and conclusion for your study. And engage them in more on your studies. Make sure you complete your basic presentation before the beep rings, in the sense before your time is. So you always tend to start on that particular timing and finish off between your 8 minutes of your presentation. Don't extend it, because you should always respect the basic presentation timing for each presenter.
And don't be afraid of answering the questions. So confidently enough, you tell them that these were your findings, and you will have to justify why the particular methodology was followed, and what was the result, what was the reason behind the result, and what did you conclude from your study. And if there are any drawbacks from your study, the drawbacks can also be explained in the conclusion, saying that these are the drawbacks from the study. In the future study, this can be adjusted for a better research questions. And talking about a poster presentation, which is mostly for the beginners. So the poster presentation, the title forms the most important thing in a poster presentation. The title should be catchy enough and make sure the font is visible when someone sees from a distance also. The important point in a poster presentation is how do you make sure that you attract the audience, make them read your poster from the top to bottom of a poster. And make sure you organize your data in a poster with a clear organized one with a less word count, and introduce more pictures, graphs and tables so that it is self-explanatory to the audience. So the basic titles which you present your poster presentation is same as your paper, starting from your title, your introduction, why the study was planned, the methods, as a flow chart you can explain them. So these are the step 1, step 2, step 3 which I have done in my study. The results can be presented as a graph or a table, and then your conclusion can be your point 1, this was the conclusion, point 2, this was the conclusion, followed by your references and your acknowledgement. So this is the basic steps or criteria which we expect in a good poster presentation. So moving to the design and the readability of a poster presentation, make sure that the background color is legible enough, the font size are visible, the flow of reading the tables and graphs are arranged to be more self-explanatory for the audience. So you tend to spend more time in organizing all your complete research in that 4:3 poster. So make sure that the font size is readable and insert numbers from the introduction or aim of your study to the references so that the audience who is reading it can go with the flow of your research. And if you're not able to insert more information, say your research has got more and more conclusion, or you want to explain the audience more about your research, it is always easy that you insert a QR scanner in your poster so that the audience can scan the QR scanner to get more data from your research. So most of the organizers will allow you to display your posters in a particular slot, and you will have to be near the poster for 5 minutes to answer the question and answer for that particular poster as such. So when the judges comes and evaluate them, you have to explain them on that particular poster what is in a 5 to 10 minutes of duration of time. And if somebody else of the audience comes up, then probably you have to explain them what was your research topic and how the poster was planned and this research was done. So this is an example of a well-organized poster presentation. If you look into it, starting from the title, the presentation, the title is more clear and legible. The presented details are there. The flow is more easily for the audience to read. The sections are separated clearly. The background color is good. The font size is very well organized, and it is more presentable for the audience to read. So starting from introduction to the references, it is more clear that once it is self-explanatory. So the audience itself, when we look at the poster, it engages them to read from introduction to references in a particular sequence. So the common mistakes to avoid your poster presentation is it should not be a too bright background. The font may not be readable in some posters. It can be either too small or too big. The flow or the structure is not organized. It looks more haphazard. So these are the common mistakes which we see in a poster presentation. You make a very brighter background. The words are not legible enough. There is little jumble enough of your words so that the flow is not proper enough for that to understand your particular research. So these are the common mistakes which when we plan for a poster presentation. So you should be careful enough to organize your posters in a way so that the flow is maintained. It is more self-explanatory rather than you explaining the poster to the audience. So the benefits of all this poster and the paper presentation is it develops your lot of confidence in the leadership
abilities. It helps you to network with other other postgraduate students of multiple colleges, and you help them to collaborate with you. And it enhances your institution's recognition and reputation of your particular college. So what are the tips for your success? You always plan for your conference much early. When a conference is planned, we always plan your conference 6 months prior to it, and we give them multiple deadlines for the poster presentation or the paper presentation, abstract submission. So you make sure that your study is planned at least 6 months before your conference happening. You prepare your study objectives, abstract, and then you complete your study. Then you start preparing your slides. Either it can be a paper or the poster presentation. You prepare them, you practice it for more time so that you are more confident enough in dealing with all kind of questions. At the end of the day, you have to be facing both positive and the negative feedbacks. So it helps in a good way that you are more organized in your research and you get a constructive feedback. So it will help you in improving your methodology of your particular research, because when in a conference you tend to meet people with multiple ideas, so they can give you both positive and negative feedbacks of your research. What changes can how the changes can make your study more better, and probably for a more research oriented, it helps you to enhance your research. And it is always be careful that you stay with the conference deadlines for the research abstract submissions. So my final conclusion is that the presentations are only the starting point for your research journey, which shapes your research methodology through a constructive feedbacks from the peers who are more experienced in that particular topic. So it shapes you as a scholar, communicator, and an innovator also. So thank you so much for your patient listening. If there is any feedback, you can get in contact with me. And if there is no doubt, see you all in Bhubaneswar. Thank you so much.
Thank you, Dr. Mahesh. It was a wonderful presentation, and hopefully the postgraduates will take some lessons if in the upcoming conference at Bhubaneswar, and I hope we will get good quality stuff. Thank you. And any questions can be put in the chat box so that we can answer that. Now, over to you, Dr. Subalakshmi.
Yes, sir, we are ready to, I don't think we have any questions as of now. So we can present the certificates to the speaker and the moderator, sir.
Right.
Thank you for the wonderful and practical insights, and heartfelt thanks to our moderator, Dr. Viral sir. I now request the moderator to present the certificate to the speaker.
Can you share the slide?
Punya, please stop sharing and share again, then it will happen.
Thank you so much, ma'am. Thank you so much.
Thank you, sir. We will now present the certificates to our moderators.
This is certificate for, yeah, thank you. Thank you.
Thank you, sir. Thank you.
Thank you, sir. With that, we come to the conclusion of day one of the first National PG Orientation Program. My heartfelt thanks to all our speakers, moderators, participants, and organizers for making this day so enriching and memorable. We look forward to welcoming you all tomorrow for another day of learning and inspiration. Kindly join with us by tomorrow morning 10 a.m. Thank you.
Thank you, dear all. Please do join us at 10 a.m. tomorrow morning. Tomorrow will be research methodology and all the other research related topics, please do join at 10 a.m. tomorrow. Thank you again for the opportunity to host all of you. Thank you.
Thank you. Thank you.
Pavni, you can close the webinar, Pavni. Thank you.